This is the Deputy Clerk. Just an announcement that we are now live on the internet.
And Peter, I see you just joined us. Would you like to do a quick microphone test?
Hello, hello.
I can hear you. Thank you.
Awesome. Thank you.
And Kim Walker, I see you've joined us as well. Would you like to do a microphone test?
Hi, thank you. Can you hear me?
I can hear you. Thank you. And Jen Loving, I see you've joined us as well. Would you like to do a microphone test?
Hello, can you hear me?
I can hear you. Thank you very much.
Okay, let me see if it shows me. Okay, thank you, Jody. Bye.
And Jolene, we can see you and hear you. Just wanted to let you know.
Thank you. I was just checking my link to make sure it was accurate with my assistant. Thank you.
No problem. And Dr. Duan, I see you as well. I don't hear you right now, but I do see you.
Well, I can give you a quick test. Can you hear me okay?
I can hear you as well. Thank you very much.
Perfect. Thank you.
And Supervisor Chavez, I see you as well. Would you like to do a quick microphone test?
Hi, Colin. Thank you.
I can hear you loud and clear. Thank you.
And Jolene, I love your background.
And Supervisor Ellenberg, I see you've just joined us as well. Would you like to do a quick microphone test?
Hey, Dave, how are you?
I can hear you loud and clear. Thank you very much.
Thank you.
Good to see everybody joining us. Saw Jolene. Dr. Smith, it's good to see you.
Nice to see you. Can you hear me?
Yeah, perfectly.
Good.
Just doing our mini mic checks. And I see Adriana. Welcome. Kathleen, Sarita, Ms. Loving, James, Raul. If you want to just say hello real quick, it's just how that way you'll know we can hear you.
Hello. Yes, can you hear me?
Yep, perfectly. Thank you.
Hello.
Hi, Jen.
Hello.
Hello, Kathleen.
Hi, everyone.
Matt, welcome.
Hi, good afternoon.
I don't know who that was. Who was that? They were very sweet. Oh, Adriana. Thank you.
Good afternoon.
Welcome, Maria.
Thank you.
Good afternoon, everybody.
Hi, Angelique. And I see Jennifer. Good.
Hi there.
Welcome.
Thanks.
I see the sheriff.
Hi, how are you?
Good to see you, Lori. You've got a whole room to yourself. That's awesome.
No, I'm going to move the camera in as soon as I can figure out how to do that.
Hey, Rob.
Good afternoon, Cindy.
Welcome, Russa. And Andrea, good to see you. Sylvia, welcome.
Hi, how are you?
Perfect. We're all
Awesome.
very good. Just making sure we can hear everyone.
Awesome.
we're going to go ahead and get our meeting going. And I want to welcome everyone. And I know it's going to take folks a minute, so we'll just let people join as they're able. We're beginning our April 29th joint special meeting of the Children's Seniors Family Committee and the City of San Jose. I never remember the acronym for PSFSS.
Public safety, yeah, finance and strategic support. That's a confusing one.
Thank you. Thanks so much, Raul. And I'm going to just talk as people join on just a little bit of process, and I'm going to repeat the process a few times because we have so many guests with us today. So today is a meeting of our two committees and a committee of the whole for the City of San Jose if they exceed their committee numbers, which I'm glad they're going to. That just shows a lot of interest. What I'm going to do is we're going to do our roll call, and then I'm going to talk. We'll do roll call, and then the other guests on the panel, we're going to have everybody introduce themselves. Councilmember Perales and I are going to share our joint responsibilities as chairs of these committees. And just for those who are listening, the way we're going to do this is that we're going to go through each section. So item 2 is the bulk of the meeting. We're going to hear A, B, and C. We're going to get questions or comments from the folks that are participating in our committee. And then we're going to take any feedback and public comment before we take any action on item 2. But we're going to hear all 3 items together. And I think that will be more helpful in terms of people being able to shape their feedback for us. Then we'll go to public comment, and that is to speak to any item that is not on the agenda, but within the purview of this committee. One other thing I'll note is that we're going to do a roll call of the 2 committees, but we've invited a number of guests to sit on the panel with us today, some who will be presenting and some who won't, in order to make sure we have robust feedback from a broad cross-section of the community, because the work we're talking about belongs to so many different parts of our organizations. And I apologize, I'm going to over communicate as we go through the process, just to make sure that that everybody knows where we're going. If anybody has a comment or question during the meeting, feel free to raise your hand. My hope is to let each presentation be completed thoroughly before we start taking questions on that particular item. So with that, I will formally begin the meeting, and I know we're now live, and I will ask the clerk of the County Board of Supervisors to call roll.
Good afternoon, Vice Chairperson Ellenberg
I'm here.
and Chairperson Chavez.
Here.
Thank you. You have a quorum.
Thank you, and I'll turn it over to Councilmember Perales.
Thank you. And I'll ask our city clerk to do our roll call.
Arenas,
Here.
Jones,
Present.
Mahan,
Here.
Jimenez, Perales.
Here.
We have a quorum.
Here.
Thank you. We have Sergio, and then we have other members of the San Jose City Council. So may I ask members of the San Jose City Council to introduce themselves also? Councilmember Perales?
Yes, absolutely. So and maybe I'm gonna look at the screen here. Sorry, going across. Maybe I can ask our clerk to call out, because we do have a number, and we can just see if we can get a roll call on the others that are present, if you don't mind.
That'd be great. Thank you.
Arenas,
Oh, sorry, and I meant for the additional members of the council that are not on the committee.
oh, I see. Okay. Just a moment, please. Foley,
Here.
Esparza, Davis,
Here.
Carrasco,
Present.
Cohen, Sam Ricardo. Thank you.
Great, thank you very much. And Cindy, would you like me to do my introductory remarks at this time?
Sure.
Great. So yeah, well, we'll just welcome on behalf of the city's Public Safety, Finance, and Strategic Support Committee. It's always a mouthful for us as well, Supervisor. And we're happy to be here on this joint special meeting with the county's committee, and we're really looking forward to the continued conversation. I want to make sure to give credit to member of the committee, Councilmember Sylvia Arenas, who has helped to lead this effort from the beginning and has created this opportunity on these joint meetings that I think are actually a great example of how the county and the city can at times work together through the committee process, which doesn't always happen, and allow us to have some early dialogue on issues that are very important to both of us, and be able to have that early conversation before it actually makes it up to votes at either the Board of Supervisors or the full council. And so I want to say thank you to Councilmember Sylvia Arenas for continuing to be able to champion the issues of sexual assault and child sexual abuse, and look forward to the presentations and the commentary for today. Thank you.
Thanks so much. So again, I want to thank all of you for joining us, and I wanted to acknowledge that who we also asked to participate, who've joined us today as members of our who are sitting on our virtual dais, because we do want your feedback and your input. We invited Adriana Caldera, who's the interim CEO for the YWCA, Dr. Marianne Dewan, the County Superintendent of Schools of Santa Clara County's Office of Education, Chief Laura Garnett, our probation officer, Casey Halcon, the Director of Victim Services for the Office of the District Attorney for the county, Dr. Maria Herne Yova, I'm so sorry, doctor, from Kaiser Permanente, who's shown a great leadership in this area, Kathleen King, the CEO of Healthier Kids Foundation, Bob Mendicucci, the Director of Social Services Agency for the County of Santa Clara, Molly O'Neill, our Public Defender, County of Santa Clara, Aaron O'Brien, the CEO of Community Solutions, Chief Von No from the Sunnyvale Police Department, and who's also the Santa Clara County President of the Santa Clara County Chiefs Association, Jeff Rosen, our District Attorney for Santa Clara County, Renee Santiago, the Director of the Santa Clara Family Health and Hospital System of our county, Dr. Jeff Smith, our County Executive for the County of Santa Clara, Jolene Smith, the CEO of First Five, Santa Clara County, Sheriff Lori Smith from, well, I was going to say from the Office of the Sheriff, but she is the Sheriff. And I know that we have a number of other leaders, including Jennifer McGuire, the Assistant City Manager, Chief Anthony Mata from San Jose PD, Deputy Chief for San Jose PD, Al Washburn, Captain Randall Schreifer from San Jose PD, Lindsay Mansfield, from the Director of Support Services for the YWCA, Jackie Morales Fernan, the Director of San Jose, our San Jose Housing Department, and Reagan Henninger from the Deputy Director from the Housing Department, Rose, I'm so sorry that I can't say your last name, the Senior Deputy City Attorney. Rose, can you please say your last name?
Yes, it's Song Tatari.
Song Tatari, thank you.
Thank you.
Kim Walker, the Safe Program Coordinator for the County of Santa Clara. Sarita Coley, President and CEO of Asian Americans for Community Involvement. Perla Flores, Solutions to Violence Division Director for Community Solutions. Esther Perez-Steekman, the Executive Director of Nextdoor Solutions to Domestic Violence. And Dana Bunnett, the Director of Kids in Common. If I missed any of you, I think it's because you're going to be on a panel. So, so I'm very excited to have so many of you here with us today. And let me just remind everybody, just to give a little bit of a history lesson, that this meeting is a follow-up to the joint Children's Family Seniors Committee and the City of San Jose meeting, PSFSS committee meeting on sexual assault and sexual abuse held on April 15th, November 2019, and November 20th, 2019. And since then, both the city and the county have really been working a great deal on our services. And I just want to say that the reason we did the first meeting was that under the leadership of Councilmember Arenas, that we realized that really what you said was really critical, which is our ability to work together at a really core level was going to be really important if we were going to be able to move forward on these initiatives and these ideas. Since then, both the county and the city have done amazing work. This meeting is an opportunity to check in only on a few of those areas. So, if we were at some point, we'll be having continued meetings, but what we wanted to be able to focus on today was on really three chief areas: the Child Advocacy Center, the city's sexual assault response and strategy work plan, and we wanted to have a discussion about housing for survivors of gender-based violence and child sexual abuse. So just as a reminder, in terms of our process today, that we're going to hear from all presenters under items 2A, 2B, and 2C. Everybody on the dais will have an opportunity to ask questions after each presentation, but I do want to ask that we wait till each of those presentations is over. I'll chair both 2A and 2C, and Councilmember Perales will lead us through item 2B. After the presentations under 2C, we will take public comment, and I want to make sure people know that there will be time for public comment, and so that will happen under 2C. Then we're going to come back to our virtual dais for comments, questions, and recommendations. Is that all right for everybody as a way to go forward? I know there's a lot of us, and this is going to be a little clunky, but we'll make it through together. All right, everyone, thank you. So with that, our first presentation today is from the Office of the District Attorney, Valley Medical Center, the San Jose Police Department, and the YWCA, relating to the opening and operation of the Child Advocacy Center and methods to improve services to ensure its proper utilization. And James, if you would like to, I'd love to start with the video and then move into the presentation, if that's okay.
Sure. Are you going to show the video, or would you like me to pull it up?
If you can, that would be great.
All right, just give me a second.
Did I just surprise you?
It's all good. I'm going to get that ready to go. Just give me a second.
Thank you.
Okay. So if I could share my screen. Can people see my screen?
Yes.
Okay, great. Here we go.
Gloria lives in Gilroy. Way is in San Jose. Pedro is from Palo Alto. All three are victims of child abuse. They need a comforting counselor, a friendly police officer, and compassionate medical care, all in one safe location where they will be listened to and cared for. They need the Children's Advocacy Center of Santa Clara County. In the past, victims of abuse and their families had to navigate services in multiple locations throughout the county, each trip adding to the mileage, the trauma, confusion, and frustration. Today, we are so proud to show you the place we have created for them. I'm Casey Halkin, Director of District Attorney Victim Services, along with Percy, our court support dog, here to welcome you to the Children's Advocacy Center, where these once widespread services are now together under one roof. Welcome to the Children's Advocacy Center. Come on in. The District Attorney's Office, in partnership with the County Board of Supervisors and Santa Clara County Valley Medical Center, is bringing a national model of excellence to children in our communities. The CAC is staffed by a team of highly trained and compassionate specialists who are here to help every child and family who walks through our door whenever they need us. When you arrive at the CAC, you will be greeted by one of our victim advocates who will talk with you about the resources and services available while your children play in our safe and child-friendly lobby. We understand, speak, and care in every language. We know that when a child is hurt, the whole family is affected. Our CAC team is here to help take care of the entire family. We have a clothing closet, snacks, emergency supplies, and age-appropriate activities to support the whole family while you are visiting our CAC. The first thing that our team must do is to determine if a crime has been committed and to make sure the child and the community is safe. Some of the finest and well-trained officers from local police agencies, including the San Jose Police Department and the Sheriff's Office, will work with families to understand what happened so they can help to protect the child and other children. To do this, the team uses a special interview room designed to put the child at ease. Children are interviewed by certified forensic interviewers, which reduces the number of times a victim must recount and relive the crime. Healing a child's mind is just as important as healing their body, and our team includes confidential advocate counselors who can help ease the trauma. Making sure a child or teen is physically healthy and examined with the highest degree of professionalism and care is one of the primary roles of the CAC. We have a medical and nursing team with decades of experience in treating and caring for children of all ages. Our CAC benefits from the support and expertise of many excellent partners. We can draw help from all over Silicon Valley, including our county hospitals, Santa Clara County Valley Medical Center and O'Connor Hospital. Our children will lack for nothing when it comes to their well-being. The CAC is not just for reacting quickly and comprehensively when a young member of our community has been harmed. We are committed to exploring new ways through training, research, and raising community awareness that will help prevent child abuse. This community and its children deserve the very best, especially in their time of greatest need. From your home to ours, our center of safety and healing, we are here for you at the Children's Advocacy Center of Santa Clara County.
Thank you, James. And I'm gonna let you get started with this presentation.
My pleasure. Thank you very much. And I'm really glad you all got to see that video. I think it's a great introduction to what we're going to be talking about today. I'm going to share my screen again to show some slides. And we're going to talk, and by we, I mean Dr. Sturm, who you saw in the video, Interim CEO of the YWCA, Adriana Caldera, and Lieutenant Jimenez from San Jose Police Department. We're going to talk to you about what we're doing at the CAC and what our plans are going forward. So I'm going to share my screen now. So the CAC, the Children's Advocacy Center, I've been saying for a little bit, is a 20-year dream come true. So many people who've worked in the fields of law enforcement and victim advocacy and medical services have been hoping for this day and for this dream to come true for a long, long time. I'm really glad, though, that we started by talking about events from 2 years ago, and a really important event, this meeting, the joint meeting between the Children's Seniors and Family Committee and the San Jose City Council. When we were all here together 2 years ago and talking about this great idea that children should not be moved from place to place to place, but that all of the services for children who've been sexually abused or physically abused should be under one roof, we all agreed this is a great idea. It takes a lot of things for a great idea to go from being a great idea to being a reality. And this is a photo of the outside of the building you saw. The space you saw in the video takes about 2/3 of the first floor of this building. So it's a big floor plan, a big footprint to co-locate all these services together. There's so many parts of what are co-located here that it took quite a lot of coordination just to get it built out and to start working on it. So I really want to specifically thank Supervisors Chavez and Ellenberg, Dr. Smith, DA Rosen, all of whom are stars of the video you just saw. I want to thank Chief Garcia and Chief Mata from the San Jose Police Department, the Police Chiefs Association, because all of us had to work together. Paul Lorenz from Valley Medical Center, Bob Minicucci, Aaron O'Brien, and Adriana Caldera. There's such a long list of people and agencies that work together to bring this idea that we're all going to be partnering together and working for the best interest of the child in a coordinated way. One of the things that I hope you see from this list of partner agencies is that what we're trying to do is to make sure that when there's a police investigation of child sexual abuse, that we're coordinating that with the medical team, that we're coordinating that with victim advocacy and counseling, that we're coordinating that with the Department of Family and Children's Services. We planned it together, we designed it together, and we're providing better services. I said we will provide. We've already started providing better services together. The first day that we opened for medical exams was Monday, April 19th, just shy of 2 weeks ago, and there were 3 children who had medical exams on that day. Through tomorrow, there are going to be 28 medical exams for children that have happened at the CAC. And just to think about that in context, if we see children at that same rate for medical exams over the course of a year, we'll more than doubled the number of medical exams for children who've been sexually or physically abused that we've seen in years past. I'm going to show you some of the places that you saw in the video just to emphasize that children are the focus appropriately of the Children's Advocacy Center. Every place in the center is focused on what is the best for the child, what's going to make the child most comfortable. We know that it is because of a terrible crime, a terrible situation, a terrible series of events that has brought a child to this space. So we can't erase the pain that's already happened for that child, but we can make sure that going forward, we're doing everything we can to make that child have the best experience possible in a terrible situation. The conference room that you saw in the video for training, we already have our first training scheduled for this conference room. We're going to be having a training for detectives throughout the county on forensic child interviewing in July. And we're hoping that as we go forward, that this training room and the CAC become a center for best practices in child abuse investigations, in child abuse treatment, and child abuse prevention. This is just going through some of the places you saw in the video. I want to turn it over now to Lieutenant Jimenez from the San Jose Police Department to talk a little bit about the interviewing capacity and what we're building toward here at the CAC. Lieutenant Jimenez?
Hey, thank you. James. I really appreciate it. Before I start off with this slide and the next slide, I want to just, on behalf of the San Jose Police Department, I want to thank Assistant District Attorney James Gibbons Shapiro for managing such an important project. Without you, James, we wouldn't be here today. So I want to say thank you to you. I know you don't get a lot of credit, and I think you deserve a lot of credit here. And also, personally, I want to thank City Manager Dave Sykes, Assistant City Manager Jennifer McGuire, Peter Hamilton, who help us coordinate all our work plans, such as the CAC, which keeps us on track to reaching our goals. In addition, I want to recognize the vision provided by Mayor Sam Licaro, Vice Mayor Chappie Jones, and the council members in general, but specifically Council Member Sylvia Arenas, Raul Perales, and Magdalena Carrasco. The support you all provide the San Jose Police Department truly is appreciated and results in positive accomplishments like the one we're seeing today with the CAC. I also like to highlight the leadership provided by Chief Mata, his administration, my captain, Captain Schriefer, and my counterpart lieutenants Brian Anderson and Rob Lang. Their actions underscore our department's dedication to our children, and for that I thank them. Lastly, I want to thank all the police detectives throughout the county, not just San Jose PD, all police detectives, who will be conducting the vast majority of difficult interviews. And thank you to all the DFCS social workers, the district attorneys, the advocates, and the medical personnel who will be working together for a common goal to serve our children. So I felt it was important just to say thank you to those people. And now going to the slide, the San Jose Police Department is committed to helping out with the multidisciplinary interview. We helped James acquire the video and audio recording equipment that's currently in the room. We have a coordinator who's assigned to San Jose PD, and she'll be coordinating all the interviews which occur at the CAC. We also contract with a child forensic interviewer And she will be helping not only San Jose police detectives, but any detective in the county, or any detective that conducts an interview in this county, even outside the county. And the San Jose Police Department will also be part of the leadership team, as you can see, to help coordinate the services for our children. If you don't mind, James, the next slide. And this is an example of one of our interview rooms. They're child friendly, and they have audio and video recording systems, and they're basically equipped so that we can obtain disclosures from children and not have to have them repeat what had happened to them. So with that, I'd like to thank James for allowing me to be here today, and thank you.
Thanks. Before I turn it over to Adriana, I want to especially mention Sheriff Smith and the Sheriff's Office, who also has been instrumental in the planning and the design for the Children's Advocacy Center. Captain Rodriguez and his team especially were very helpful, and I'm sorry I had that in my notes and I skipped saying that, but special thanks to the Sheriff's Office. I'm going to turn it over to Adriana Caldera to talk about victim advocacy at the CAC.
Thank you, James. Again, I'm Adriana Caldera. I am the interim CEO at YWCA Golden Gate Silicon Valley, and we are honored to be one of the co-located victim advocacy providers at the Child Advocacy Center. Your YWCA, along with Community Solutions, operates the 2 rape crisis centers for the county, and both organizations have staff on site at the CAC providing confidential, trauma-informed support services to child sexual assault survivors and their families. On-site services include accompaniment for medical examinations, as well as crisis counseling and support, and connection to additional wraparound services. When working with child survivors, advocates are providing emotional support directly to the child and providing information and support to their parents or guardians, and connecting the family to additional supports that are available. Children and families are also able to receive food, clothing, and a toy or book for emotional support during their visit. Children are often nervous and somewhat unsure of what they will be experiencing. The service providers at the CAC take extra effort to establish a safe, friendly, and supportive environment for children and their families to receive critical services during an extremely traumatic time. Additionally, confidential advocates connect child survivors and their family members or caregivers with ongoing support beyond their initial connection with the CAC. And these services can often include systems advocacy, court accompaniment, case updates, ongoing case management, crisis counseling, connection to support groups, and referrals for ongoing therapeutic services. In 2020, your YWCA provided over 700 sexual assault survivors with crisis intervention services. We provided over 1,300 individuals with clinical therapy sessions and over 3,000 sessions of ongoing case management and advocacy after the initial report of a sexual assault. That's a 120% increase in sexual assault services provided in comparison to 2019. And as more children return to schools for in-person learning, we expect to see the number of children who are identified as survivors increase as well. And I'd just like to take this opportunity to state that the creation of the CAC could not have come at a better time. And I want to take this time to thank all of the partners that came together to launch this state-of-the-art facility, and to thank the City of San Jose and Santa Clara County for prioritizing the needs of sexual assault survivors and recognizing the unique needs of child sexual survivors. Thank you.
Thanks so much, Adriana. Dr. Sturm, I'm going to turn it over to you to talk a little bit about the medical clinic that's part of the CAC.
Good morning. Can you hear me?
Absolutely.
Yeah. So first of all, I want to join everyone in celebrating the extraordinary 2 weeks that we've had at the Children's Advocacy Center. Like so many projects that have heart in them, we have been so fortunate to gather such an extraordinary team. In addition to James, who has led us from the beginning, we're so grateful for your support. Casey Halkan, the Director of Victim Services at the DA's office, has been instrumental in making all of this happen. And we've also been so fortunate to bring over Jen Putoff from DFCS, where she was serving in a leadership role in prevention, and now she is managing the CAC. Additionally, we have a new nurse coordinator who comes to us from public health, and also she is a very experienced SART examiner. So it just is, it's so good. I don't know what to say except that it's been so good these first 2 weeks. It is early days, but we have more than doubled the number of patients that we see, which in my view is a sign of how we are all communicating better and collaborating better. Two very, very brief examples. We had a case last week of a child who came in because she had been physically abused by her father. And as we had a chance to really interview her and understand better what her experience has been, it became clear that she has also experienced sexual abuse and may have experienced sexual trafficking. And we were able to transition her fairly seamlessly from a child physical abuse evaluation to a safe exam and provide her with medications to prevent sexually transmitted infections, information about how to protect herself, and more than anything, make her feel very heard. That was very beautiful. Another example is, as you all know, the Keiki Center, the shelter for children in foster care, has been about 2 miles away, and we're very much looking forward to having the Keiki Center move to the Welcoming Center on Olin Street near Santana Row, which will put those kids so close to us, so nearby. And we're just thrilled to have the opportunity to provide the best quality care with great efficiency in ways that we haven't been able to before. So at present, we're open from 9 to 5, but we are all geared towards a 24/7 model, so that we can provide safe exams to children from 0 to 17 during the daytime. And unfortunately, so often things happen at night. So we're setting up for call schedules for the evenings and weekends. And we also plan to be able to do physical abuse evaluations into the evening. The reason why that's so important is because often it takes until 3 or 4 o'clock in the afternoon to realize that a child has been physically abused, for someone to call the CAN Center, for DFCS to identify the emergency response social worker, and then for the emergency response social worker to make it to the medical provider. So we're looking forward to be able to provide comprehensive medical care within hours of learning of a physical abuse case, which will help DFCS in their decision-making about whether that child can stay with their family or whether they need to be placed in protective custody. I would like to invite all of you to come visit the CAC and also to call us, 24/7. Even if we're physically closed, I'm available evenings and weekends, and we want to hear your questions. And more than anything, we want to make sure we provide first quality medical care to kids who have experienced abuse and neglect. Thank you.
Thanks so much, Dr. Sturm. I want to talk a little bit about our future plans and what we're working towards. So we're going to be all partners who are involved in it are thinking about what we're going to be needing for the future. We think we're going to need, and we expect we're going to need, we know we're going to need more trained forensic interviewers to supplement the staffing we already have. We're going to need more positions for weekend and evening and related work and coordination of that. One of the things that was not part of the original purchase plan for medical equipment was a state-of-the-art X-ray machine for child abuse cases. I'm happy to report that we planned for that regardless and have an X-ray room outfitted with lead-lined walls because we came in under budget. And thank you, Fleets and Facilities, for all your work in helping us to build out this space and to bring it in under budget. We do have the funds to purchase that X-ray machine. You're going to hear members of the Board of Supervisors, Dr. Smith, I expect in the next few days, about some staffing needs from the medical side in order to make sure that we're able to properly staff that X-ray room and to do those X-rays on site at the CAC. That this yellow square is the portion of the CAC that was not featured in the video. It's the X-ray room and also some lab work areas. And you can see from this diagram how much of this first floor were taken up, which is great. I mentioned that the health and hospital system is going to be asking for some additional positions, and those plans are in development, and hopefully we're going to be finalized in the next few days. I guess what I'd like to end with before we go to your questions and comments is something that I referred to, is that this was a dream come true in so many ways. But as you all know, a dream doesn't come true because you had a good dream. And a good idea doesn't come to fruition because everybody agrees it was a good idea. It really took the leadership of you all to make sure the funding happened, the coordination happened, and that there was just a collective will right now for all of our groups together to do this together. Because there's lots of reasons why this didn't happen over the last 20 years, but the main reason is because we didn't have the leadership team that you're seeing here on this call, from city leaders, county leaders, especially our elected leaders, to make sure that this was going to happen. And I can't thank you enough for changing a good idea to actually something that is good from the start. So with that, we'll turn it over to any other questions or comments.
Thank you. And I just wanted to also say just one other piece of information that might be of interest to the group, that under the leadership of Dr. Smith, we're really looking at the area where we have the Child Advocacy Center to become a center of excellence for children's services. And what's significant about that is that we have a lot of high needs children in our community that come to us from very different places. And so being able to reimagine the O'Connor Hospital as a center of excellence for children is a part of that vision. And I'm really, really excited to be a part of the beginning of it. And Dr. Stroom, as per usual, just you're right, there are a lot of good ideas, but this is a woman you don't say no to. So if you've met her, you know exactly what I'm referring to. And so she is a real advocate for children, and congratulations to see your vision come true as well. And also to James, what a miracle worker you are. So with that, I'm going to open it up for questions. I just want to remind people who are attending that when we get to 2C, we will take public comment. But if there are any comments or questions from the panel, I'd be interested in engaging you now. Yeah, Kathleen?
Just, and I'm sure this is covered, but transportation, anyone coming from Morgan Hill, Gilroy, is there transportation set up for them right away?
Let me ask, and I'm not sure exactly the right person to ask that of, if that would be James. Thank you.
Sure. The first contact that children who are abused are having is not at the CAC. It's not a walk-in center. So you can imagine a child has said to their teacher that someone's been doing something bad to them, and there's now a mandated report to a police officer, and then it's that police department that is arranging transportation, or the Department of Family and Children's Services that's arranging transportation for the child to be there for their medical exam, for their interview, and for the other services on site. That's a great question. Thank you.
Sylvia?
Thank you, Chair. I was wondering what kind of hours will the center keep? Will it be flexible evening hours? What does that look like?
Yeah, I'll answer it a little bit, and I know that Dr. Sturm wants to talk about it too. So our normal business hours are Monday through Friday, 8 to 5, but we are also a 24/7 facility. And what I mean by that is that if a child needs to have a medical examination on Saturday, or to have their multidisciplinary interview on Sunday, that's when it's going to happen. Dr. Sturm, I know, mentioned that the timing of the way child abuse sometimes gets reported means that being able to be open into the early evenings is important. And part of the expansion plans that we referred to were about extending those normal hours into the evening. But the center is open and available 24/7. And I'll just have just a quick footnote to that is that we're not expecting to do a child interview at 3 in. That's not really the best time for an 8-year-old to be talking about and being alert and ready to answer questions about what's happened to them. But it might be a early evening, or it might be on a Saturday.
Sure.
Dr. Sturm, did you want to add to that?
Well, what I would add is that we already do have a program in place for evenings and weekends. As you all probably know, the adult and adolescent SART team, the SAFE team, is available 24/7. And we are going to use that model to expand our services to cover children up until 17. And I want to expand on what James just said about what happens in the middle of the night. Nobody's good in the middle of the night. You know, anybody who's ever been to the emergency room with their kid at 2 o'clock in the morning knows that it's really, really difficult to get anything done. So we really do our very best every day to listen to the family and sort out what the needs of that particular child and parent may be. Sometimes if a parent presents to the ED at 11 o'clock at night, we rub our hands together and decide that we're all going to do much better if the child comes in at 8 or 9 o'clock the next morning. They'll be much more cooperative with the collection of forensic evidence and with interviewing. And so we take a breath and we tell the parent not to give their child a bath and come in the next morning. And it works better for everyone.
Thank you, Dr. Sturm. And lastly, I was just going to ask if I know that there's a lot, like a plethora of services and referrals that will be accessible on site. I'm just wondering if that includes emergency housing and maybe some calming kits. We had some wonderful calming kits put together with First Five, jointly with First Five. Kathleen King, I know that your husband actually helped with putting together some of the kits physically, labor of love, really. And we found them very meaningful and successful with our community. I wonder if these 2 items, one, the referral to emergency housing, motel vouchers or something of that sort, because as we understand, there's a lot of victims who live with their perpetrator. And sometimes it's a matter of just finding an alternative place to live.
Sure, I'll start that answer and possibly Adriana will have something to add to it too. We did have a case last week where a child was having a medical exam, but while there, it was clear also that the mom who was with the child was a victim of domestic violence. And our victim advocacy team, which is on site, ready to go, arranged for relocation assistance for that family. And that's the kind of on-site immediate cooperation and coordination that is what we're working for. And that kind of early success is an example of what we're trying to achieve. Adriana, did you have something you wanted to add to that?
Yeah, sure. I know when I had presented, I mentioned that there were additional wraparound services that advocates could connect children survivors and their families with. And one of those is additional housing services. So the YWCA and with Community Solutions, we do have additional supports around the area of housing and shelter and motel for survivors. And so that's an additional support that is available to families and children that are coming through the CAC.
Perfect. And I see Jolene is also with us today. So thank you so much, Jolene, for putting together our calming kits. A tremendous amount of effort. And this was really during the pandemic so that kids, can learn their own self-soothing. But I think it's a tool that can be used beyond just at home and something to walk away with for our families. So that might be something we might consider.
Councilmember, if I can just add that along with the County Office of Education, who's in their inclusion collaborative, that's our partner in the development of those common kits, we've already been in conversation with Jennifer Putoff to ensure that First Five can provide those kits to the center on an ongoing basis. It's going to be in our budget for this year. So thank you for bringing that up.
Awesome. I wouldn't expect anything less, Jolene.
Perla, did you want to jump in?
Yes, first, thank you, Supervisor Chavez and Councilmember Arenas for your commitment and focus on this issue. It's so important. And just to highlight how all these issues intersect and how domestic violence, sexual abuse, commercial sexual exploitation of children can happen so frequently together. And so it's so amazing to have all of the services that are offered and to have the YWCA Community Solutions because all of our advocates are trained on domestic violence, sexual assault, and human trafficking, and advocates that specialize in commercial sexual exploitation and support. So looking forward to syncing with Lieutenant Anderson and figuring out for our CSEC protocol how we can bring in the Child Advocacy Center into that fold. Thank you for all the work that you do.
Carla, thanks for the reminder. That is a great next step for us. Are there any other comments or questions that folks have about this section? Yes, Doctor.
So first of all, I would like to thank you, Supervisor Chavez and Supervisor Ellenberg for inviting me for this important meeting. This work is absolutely extraordinary. And I remember 2 or 3 years ago, I met with Dr. Sturm and she had this big vision and it's all true, it's all here. And it just shows that how great we're living in such a great community and county, and we can provide the best care for our kids. So I have 2 questions. So first of all, the access is the referrals to this center. Do they need to be referred the children through the Child Protective Services, or actually the pediatrician can contact the center for an exam?
Yeah, there's a couple different entry points to having a child come to the CAC. So one is, as you mentioned, through the Department of Family and Children's Services. One is through a pediatrician who sees that there's been abuse and is going to contact Dr. Sturm or the medical team at the CAC. And another one is what I refer to as when police are involved because they've gotten a mandated report or because they've gotten a report from a family about an abused child, and they're also an entry point to getting services. I think that one of the things that we've also been learning from some other work that we've been doing around strangulation is that there are some times where the first report is coming through a victim advocacy agency, and having those folks on site and ready to go also, I think, means that that's going to be another entry point for people to be referred to the CAC for services.
Thank you, James. My other question is there like a number, a contact information our providers, let's say from Kaiser, can call directly the center?
Dr. Sturm, what's the best way that we can get the medical numbers to all people in our medical community? I think you're on mute still. There you go.
I just unmuted myself. So last week we developed a matrix to share with law enforcement and DFCS that includes all of the ways and times to reach us. I have sent it to Dr. Tayama, who's my collaborator at Kaiser. Certainly I can remind folks to distribute it to all of the practicing physicians at Kaiser, for example. But as you can imagine, we have had an extraordinary voyage in the middle of COVID. Who could have imagined that we would be able to make this place open during COVID? And in some ways, we're catching up. We're putting together our supplemental materials right now. For example, we're putting together this really, really beautiful parent handbook that Erica developed at YWCA. And Jen Putoff is putting together a website for us So all of the things that you would expect in terms of outreach to the community so people know how to find us, we are working on them, and it may take a little while, but certainly the matrix is a tool that we could provide you right away.
And Dr. Sturm, isn't it also the case that the numbers for the Center for Child Protection at Valley Medical Center will ring at the CAC and it refer people to the CAC?
Mm-hmm.
Yeah.
You can always call VMC, always. And actually, you can just always call me if you have a question or a concern, and I'll send you to the right person. Sure.
And also the CAN Center as well. We'll make sure that that's included because that's really our major portal still. Did you have one other question?
Thank you so much.
All
Thank
right.
you.
Well, thank you all. And we're going to move on to our next item. I know I have you all till 4, and part of the reason for that is I wanted to make sure there was enough time for discussion. So I don't want to cut that off, and yet I want to make sure we get a chance to get to our next item. So I'm going to turn this part of the meeting over to Councilmember Perales.
Thank you, Supervisor. And this next portion is going to be receiving an update from the City of San Jose Police Department relating to the implementation of the city's sexual assault response and strategy work plan. And I'll be inviting up Lieutenant Jaime Jimenez to kick this off.
Thank you, Councilmember Perales. Again, my name is Jaime Jimenez, and again, I'm the Sexual Assault Investigations Unit Commander. Thank you for populating that. Today, I'm accompanied by Assistant City Manager Jennifer McGuire, Crime Intelligence Analyst Angeli Montesa, YWCA Golden Gate Silicon Valley Director of Support Services Lindsay Mansfield, Bureau of Investigations 1 Captain Randy Schriefer, Special Victims Unit Lieutenant Brian Anderson, and also Family Violence Unit Lieutenant Rob Lang. And if I can have the next slide, please. Today's agenda is going to consist of the following: the introduction from the City Manager's Office, update on the sexual assault work plan, duty manual changes, SART exam coordination update, advocate referral audit, and the strategy to increase reporting. And with that, I'll introduce Assistant City Manager Jennifer McGuire.
Thank you. Good afternoon. I am Jennifer McGuire, the Assistant City Manager for the City of San Jose. Can you move to the next slide? Thank you. Because I'm a strong supporter of the collective work on the issues of sexual assault and child sexual abuse, I am very pleased to provide the introductory comments to the San Jose Police Department's presentation on their progress implementing the sexual assault response and strategy work plan. Although the police department staff have always done a great job on sexual assault, we have an extremely dedicated team of police department staff that have really embraced this work plan. They've actually been relentless over the past couple of years. This work has been a priority focus of the department among all of the other important work they do day in and day out. I'd like to provide you with a brief history of San Jose's focused work on this issue, our collaboration with the county, and how the police department work plan came to be, as can be seen in the mini boxes on the slide. So bear with me for a few minutes. To start, at the City Council's Public Safety, Finance, and Strategic Support Committee, again, otherwise affectionately known as PSFSS Committee, meeting on February 21st, 2019, the committee members took special note that the number of reported rapes in San Jose had been steadily rising and requested further information from staff at their April 18th, 2019 meeting. Then, responding to an invitation from Supervisor Chavez on March 28, 2019, Council members Perales and Arenas moved a memorandum proposing that the city's PSFSS Committee hold a joint meeting with the county's Children, Seniors, and Families Committee on our collaborative effort to comprehensively address the problem of sexual assault in the community. This meeting was approved by our Rules Committee the following week. On April 15th, the PSFSS and county's CSFC committees held their first joint meeting to discuss sexual assault, domestic violence, and human trafficking. And as you know, a range of agencies and organizations participated in this meeting, where there was produced a number of innovative recommendations related to sexual assault response. On August 18th, at the PSFSS committee meeting, as requested, the police department gave a detailed presentation to the Committee on Sexual Assault Reporting and Investigative Trends. That brings us to May 30th, 2019, We're all 5 women on our city council, including council members Arenas, Carrasco, Davis, Esparza, and Foley, held a press conference to bring attention to the alarming increase in sexual and relationship-based violence in the city over the past decade. These women issued a joint memorandum to our Rules Committee that was accepted, recommending to agendize a series of public hearings related to the administration's review and response to the joint meeting with the county, to better understand the city's sexual assault patterns and statistics, to participate in another joint county meeting, and to develop a sexual assault response and strategy work plan. At the June 20th, 2019 PSFSS meeting, that was also held as a committee of the whole so that all of our council members could attend, the police department brought forward the list of recommendations made as part of the joint meeting with the county and reported on departmental work efforts already underway related to sexual assault, as well as gave an update on sexual assault reporting and trends. On November 12th, 2019, the City Council held a special meeting to discuss the police department's sexual assault response and strategy. At this meeting, the police department staff presented and the council accepted a sexual assault response and strategy work plan based on the recommendations that came out of the City County Joint Committee meeting, work items generated by the San Jose Police Department, and additional direction from City Council at that time. Also at the meeting, researchers from the University of Texas at San Antonio that were engaged by the police department presented an analysis of patterns and trends in San Jose's sexual assault incidents data. At the February 20th, 2020 PSFSS committee meeting, at the request of Councilmember Arenas, the police department began providing regular updates on the status of the implementation of the sexual assault work plan. So that the public knows, these updates occur under the police department's regularly scheduled operations and performance bi-monthly status report and are still being provided to the committee today, with the most recent update provided at last month's April 15th meeting. At the March 18th, 2021 PSFSS committee meeting, the police department provided its first sexual assault response and strategy annual report. This report provided a comprehensive overview of the work of the police department's sexual assault investigations unit and its newly formed special victims unit. The report also provided a detailed update on implementation of the work plan. So this brings us to our meeting today on April 29th. 2 years after our first joint meeting in April 2019, we are proud to have our police department present an update on their work on sexual assault. As you've heard, we've got many people from the police department here joining us today, as well as our partner agencies. And with that, I would like to turn it over to Angeli Montesa, who's one of our amazing crime and intelligence analysts with the department, to make the department's presentation. All yours, Angeli.
Thank you, Jennifer. My name is Angeli Montesa, and I am the Crime and Intelligence Analyst for the Sexual Assault Investigations Unit of the San Jose Police Department. Moving forward with updates regarding the department's work plans. The department was responsible for 17 work items within San Jose and 5 items countywide. The completed work items pertaining to San Jose are listed here on slide 7. Completion highlights include the domestic violence lethality assessment, the intersectionality tool, which I will touch on in the next slide, the Report John project, trauma-informed care training for detectives, and the bisection of SAIU that led to the separation of the child exploit units, human trafficking task force, and 290 Megan's Law unit from the SAIU to create the special victims unit. In January 2020, SAIU created, provided training, and implemented the San Jose Police Department Domestic Violence, Sexual Assault, Human Trafficking Assessment Reporting Form, commonly referred to as the intersectionality tool. Department members use this document during domestic violence investigations to identify survivors of sexual assault and/or human trafficking. We thank and are addressing Council Member Arenas' suggestion to also have this document used in sexual assault cases to identify domestic violence cases. Since its implementation, we have found that the intersectionality tool increased the number of disclosures related to historical sexual assault perpetrated by the survivor's intimate partner. And despite the overall 9.4% decline in the rape category from 2019 to 2020, domestic 261 rape and domestic 220 intent to commit a felony sex crime both increased. Conversations are underway as the county is looking at recommending that this tool be used by all other law enforcement agencies in the county. Slide 9 provides the 6 in progress work items pertaining to San Jose, highlighting here the domestic violence high-risk response team, which has been extended to run through June 2021, and the Sexual Assault Bill of Rights, which I will discuss in the next slide. Penal Code 680.2 mandates that all local law enforcement agencies develop a card that explains in a clear language the rights of sexual assault victims and makes this card accessible to each provider in its jurisdiction responsible for medical evidentiary or physical examinations arising out of sexual assault. During the 2021 City Roadmap from COVID-19 to Recovery Priority Setting process, the Sexual Assault Bill of Rights was implemented into the current Sexual Assault Response and Strategy Work Plan and will be executed in a 3-pronged approach. This approach will be to create applicable duty manual sections, to evaluate and reformat department resource cards, and to collaborate with advocate and community partners. Lastly, pending within San Jose will be to fill the vacant positions currently in the unit dependent upon overall department resources. We also present here for you a brief overview of what the 3 units, sexual assault investigations, special victims, and family violence units currently look like. For the county, the completed department work items entailed formalizing work groups and the Child Advocacy Center, in which 3 MOUs were executed between the city and the county. There are 3 items currently in progress, one of which entails today's follow-up joint meeting, which will be moved to the completed status after today. As directed by the City Council with its approval of a memorandum from Councilmember Arenas on August 18, 2020, this section provides updates on duty manual amendments that achieve the following 2 objectives. Objective 1, requiring officers to respond to and investigate all calls for service for domestic violence, child abuse, sexual assault, and human trafficking for potential high lethality and write a police report if a crime occurred. 6 sections with regards to domestic violence, physical child abuse, endangerment or neglect, investigations of sex crimes, and sexual assault cases of the duty manual were amended. Please note that Section L 7307, domestic violence reporting, already contained a requirement for officers to respond to, investigate, and document all calls for service involving domestic violence. This has just been added here to display the responsiveness of sections of the duty manual. And Section L 6018, human trafficking, was added to the duty manual to require officers to respond, investigate, and document all calls for service. Objective 2, ensuring a trauma-informed approach to an officer's response by providing survivors with access to an in-person advocate and/or referral to such advocate by telephone, pamphlet, or resource card before the officer leaves the scene, regardless if the survivor asks for the referral services. Language was added to these 6 sections with regards to domestic violence, physical child abuse, endangerment or neglect, investigations of sex crimes, and human trafficking. The added language reminds officers of their individual responsibility to assist survivors through a trauma-informed approach, offer and explain resources to the survivor, conduct appropriate investigative tasks, make arrests when allowed by law, and properly document the incident whenever suspected domestic violence, child abuse, sexual assault, or human trafficking is discovered or otherwise reported. Alongside Objective 2, Sections L 6009 and L 6010 discuss providing survivors with access to an in-person advocate and/or referral to such advocate by telephone, pamphlet, or resource card before the officer leaves the scene, regardless if the survivor asks for the services. Section L 6017 and Section R 1526.5 were added to create a requirement for department members to provide advocacy referrals to survivors of sexual assault and domestic violence before leaving the scene, and to provide resources to survivors of strangulation and/or suffocation. Sections R 1526, domestic violence resource card, and R 1527, sexual assault report receipt, were modified to require officers to not only provide the cards to the survivor, but to explain them as well. Other related duty manual updates include Section A 3003 and A 3007 that are being modified to expedite documentation of non-investigative sexual assault reports. Section L 4113 and L 5704 are being added to create a requirement for officers to inquire if any firearms are accessible and or on the premises of a domestic violence incident. If there are, officers are directed to take custody of those firearms pursuant to a gun violence restraining order and book them for safekeeping. For sections L 6002.5, non-investigative report, it states that it is being created, but this section has been approved since March PSFSS meeting and has been added to establish a new means by which survivors may report a sexual assault while remaining anonymous. Section L 7307 was modified to implement a news intersectionality tool, and sections R 1536 and R 1536.5 have been modified to update domestic violence forms for the use of the intersectionality tool. Section 4 provides an update regarding the department's SART exam coordination. A standard operating procedure has been established to assist members of SAIU in deciding which pediatric SART exams to approve. The SOP was created after conversations with the pediatric medical team from Santa Clara Valley Medical Center, supervising deputy district attorney assigned to sexual assaults, and members of DFCS. The SOP expands on SAIU's previous practice of approving an exam if a sexual assault had been committed in the past 72 hours by adding value-based decision-making in consultation with the multidisciplinary interview team. SAIU has also prioritized open communication and ongoing collaboration with the pediatric medical team. A designated contact person within the unit has been established to discuss questions or concerns from the medical team at any time. In coordination with the medical team, SAIU is committed to ongoing monitoring and evaluation of when SART exams are approved to ensure the unit's procedures are working as intended. The following provides an update of the Advocate Referrals Audit. Overall, there were 3 findings and 6 recommendations concluded from the audit. Recommendations 1, 3, 5, and 6 highlights improving how survivors are connected to advocacy services, the evaluation of the Domestic Violence High-Risk Response Team pilot program, establishing a process for shared data with regards to the timeliness and utilization of advocacy services, and expanding work with community partners. All have a target completion date for December 2021. Recommendation number 4 has a target completion date of June 2021, and recommendation 2 regarding the standardization of referrals has already been completed. To fulfill and implement recommendations 1B and 1C from the Advocate Referrals Audit, the department and the county will need to coordinate on resource card revisions and updates. Conversations are currently underway regarding best practices for county protocol. And lastly, Section 6 provides an update regarding the department's strategies to increase reporting. The following strategies are to increase SAIU, FVU, and SVU capacity in the area of crime and intelligence data analytics, to provide timely information to community-based organizations and the Crime Prevention Unit for education and prevention as resources allow, to increase capacity in the department's Crime Prevention Unit, and to work more closely with all ethnic-based agencies with an emphasis on the Asian Pacific Islander service providers. And lastly, I'd like to thank the Public Safety, Finance, and Strategic Support Committee and the Santa Clara County's Children, Seniors, and Families Committee for having us today.
Thank you very much, Angeli, for a thorough presentation. A lot of data shared there, and a lot of great progress by our San Jose Police Department. And I want to say thank you. I think when you showed the timeline, clearly, right, we have not been able to meet as in this joint capacity all of last year. And as one might imagine, as we were talking about on the last presentation, you could expect maybe some of the work to really be or have been delayed. But that has not been the case. I think a lot of individuals have been working hard behind the scenes, as we saw with opening up of the center, and specifically with our police department here on these updates. And thank you again to Councilmember Arenas to continuing to champion that work, and look forward to a number of milestones, as we saw in the presentation here, that we'll be hitting over the coming months and then before the end of the year. So I will open it up to questions or comments from participants of the joint committee here. And I'm going to go over to monitor the raised hands. I'm not seeing any raised hands or physical hands coming up being raised. Okay. Here we are. First up, Councilmember Arenas.
Chair, I do see an attendee with their hand raised. If you'd like to go to them first.
We're gonna hold off on the public comment until after we have one more item to present, and then we'll.
Oh, I see. I apologize.
No
Yeah,
worries.
I'm in the PSFSS mode, and so thank you, Chair. And I actually want to start off by thanking Supervisor Chavez for her passion and just her leadership. She's was absolutely open and willing to partner up with me when we discovered some of the statistics that look in the past 8 years. And I know that together what we were looking at is how to break this cycle, how to interrupt this pipeline, that the sexual assault pipeline that leads into human trafficking, that leads into intimate partner violence, potentially another sexual assault or sex work, and eventually or potentially some criminalization of our sexual assault survivors. And so all I had to do was, I think it was 10 minutes it took to convince you. And I have felt, and I've said this before, I felt like Joan of Arc was with me on this venture to accomplish all that you are seeing today, because this is an absolute joint venture that we've had, and all of you have contributed. But I obviously want to thank Supervisor Chavez for agreeing to doing this together, to partnering, to have this trust with me and with our city. And I also want to thank our city manager, Dave Sykes, as well as assistant city manager, Jennifer McGuire, who's also been leading the charge on the other side of the city. And I don't want to leave anybody out. So I want to thank our, and if I do, I'm so sorry, but I want to thank our Chief Mata, Deputy Chief Schreifer, and Washburn, who are present today, Lieutenant Anderson and Lieutenant Jimenez. And I'm going to say the star of the hour is Angelique Montesa, because she gets us our data that we actually need so we can determine whether we are moving in the right direction, whether there's some impact to our city. I think in the long run, we're going to really count on Angelique for all of that and your interpretation of the data, Angelique. So thank you so much for all the hard work that you've done in the behind closed doors, if you will. And lastly, our chair was just absolutely excited to work with me. We couldn't really be in a Brown Act together because I did have a Brown Act with my fellow council members, who are Councilmember Carrasco, Esparza, Davis, and Foley, and some of you are here today, and thank you for standing strong with me. This is an issue that ties all of us together, whether we agree on other items. This is where we really stand strong, because we understand how this impacts, how these crimes impact our children in the future. And because we want to hold ourselves to a higher level, I know that our Councilmember Perales, you helped us advocate to having the Sexual Assault Bill of Rights jump to the front of the line, instead of going through the priority setting that, I would have to compete with other very important issues. But so thank you so much for doing that. And lastly, thank you, Supervisor Ellenberg, for your support and your passion to serve our children. There's so many people. This is, I feel like, we are celebrating all of the really good work that we've had in the last 2 years. And so, and I just want to recognize and point out that part of this is really systemic. What you're seeing here is really systemic, where you're looking at standard operating procedures. You're looking at duty manual changes, and you're looking at the process that a survivor encounters with a police officer on a call potentially, and the training that that police officer is going to receive that is trauma informed and victim centered, and all the way through as it goes through the investigation. And so this is by no means perfect, but I think this is, I hope, on track with what all of you as stakeholders have told us and have been telling me. And we've been asking you for the last years to be very honest with us in terms of what is working and what is not. And so I thank you for your honesty and your transparency. So this is what you're seeing today, and I'm really excited about what we have today. One of the things that I think hasn't been answered, and it's an area that I think through this joint meeting can be addressed, or we can take this offline, but this is the exams for our children under 17 and maybe under 12. And what is the best practice in terms of do we have every survivor go through a SART exam, a SAFE exam? Or does it mean if it's only over the clothes touching that they don't go through an exam, or if it's under the, skin to skin touching that they do go through an exam? But I don't know what the best practice is. I know where we have landed in the city of San Jose, and that is if it's skin to skin, then those survivors then go through onto an exam. But I like to hear from our experts that we have all around us in terms of what you would recommend. And I guess I'm asking Dr. Sturm, maybe primarily, but Supervisor Chavez, please direct me to who you think would be the best.
I was actually going to ask Dr. Sturm to respond, and also I thought the District Attorney's Office might also give some input to that, but I'm just looking for Dr. Sturm right now. She may have stepped away for a minute. Could I ask James if you could weigh in on this?
Sure. So I'll just say a few things about it. I think that there's a broad consensus that where a medical exam is needed, either to collect evidence of a crime or to provide treatment for a child, that there should be a medical exam. And whether that exam is one that's authorized as part of a police investigation, or whether it's a medical only exam for ongoing treatment, and one that may develop into one that's for evidence in a criminal investigation, I think that we're overall mostly in agreement across the medical and law enforcement communities about making sure, A, that where medical exams are needed and appropriate, that they're happening, and B, and this is really important, that no victim or no family gets a bill for those exams, that whether it's a medical only or whether it's a police initiated referral for an exam, that either way, that there not be a situation where a family is going to get a bill for this this kind of care and this kind of examination. I think that what's good about the fact that we're not siloed anymore and we're working together at the CAC is that I think that in the past, those kinds of discussions have not been happening as collaboratively as I think we're going to see them going forward. I mean, the fact that I've been joking a little that moving in together is a big deal, but I'll just say seriously, moving in together is a big deal. And the fact that we're going to have our medical staff and our police staff on site together, I think it means that we're going to be seeing much better collaboration and coordination on this. So that's my answer to the question. I think I'm hopeful for the future.
James, if I can add something, if you don't mind, just so you all know, part of the CAC is the multidisciplinary team, right? So San Jose PD is part of that, the medical team's part of that, and that's a space where we can collaborate with one another to determine if we're doing the right thing, right? And where do we need to land? So a year or two ago, we were in one spot. Now we're moving in a different direction, and we're still open-minded to move even further over if we need to be. But at the end of the day, you know, we want to make sure that what James said is absolutely true, right? That we provide them when they should be provided, and that the survivor's family should not receive a bill associated to any medical examination. And that's kind of the San Jose Police Department stance. And I believe everybody could agree on those two things. And the reality is, like James said, we do agree on majority of things. I think sometimes, and it's great that we bring it up, but there is space, Councilmember Rennes, for us to talk about that. And we are always open to talking about that.
Thank you so much, Lieutenant Jimenez. And I'm going to tell you, Lieutenant Jimenez, you've just recently started, I don't know, maybe a couple of months ago, but I feel like you've been with us from the beginning, just stepping into what the work that is before us in this work plan that maybe, you know, I think 13 items, but what represents a huge turning point for our children of color, and primarily our women, young girls of color. And so I want to thank you for all the flexibility and openness that you have. And I hope that we can continue in this conversation so that we can get to what that best practice is. But I understand that the MDT might be a place where you can continue to have that conversation. And I had asked you this question previously. I know that you expressed commitment to me in our PSFSS committee, but since everybody else wasn't in our committee at that time, I wanted just to make sure I express that. And so lastly, I just want to say that I'm absolutely excited about our Children's Advocacy Center and the way that you all will partner with one another. As you're saying, you're all moving together and you're building a really different kind of relationship, because when you move in, whether you're boyfriend or girlfriend or you're different agencies in one area, there's a lot of learning about each other's practices and appreciation of one another and the work that you all do that will lead and feed into the work that you're already doing. And so thank you. What is the District Attorney James Gibbons Shapiro? I know that when I picked your brain almost 3 years ago, you talked about this Children's Advocacy Center, and aren't we all just so excited to actually see this take place? And for all the advocates, I know this is something that we've all been looking forward to. And on our end of the city of San Jose, the systemic improvements that we've had completed and in process of doing for the last 2.5 years or so have just been tremendous. And so thank you, everybody, from detectives to, you know, the highest rank, our chief, for all the work that you do in between to lead us to this point. I truly am grateful. I know it's difficult to sometimes have some changes, but you've never resisted, you've never shown opposition to any of my recommendations, and I'm absolutely grateful for that. Thank you.
Thank you. Okay, and next up we have Perla Flores.
Yes, Raul. So I want to really thank Councilmember Arenas for all of the work that you've done to ensure that survivors of domestic violence, sexual assault are afforded the rights to have advocates with them during at follow-up interviews, and really to bridge that gap and ensuring that an in-person response or an advocate response when a survivor is identified. And it's really interesting to me because these are legal rights that survivors have under the state law, and legal mandates are prescribed minimal requirements, and they're not what's best practice. They're not what's the most that we could and should be doing for survivors. And I feel in Santa Clara County that our partners always go above and beyond because they've afforded those same rights to human trafficking survivors, and even though it's not a state law, but the right to have a human trafficking advocate support survivors is included in a law enforcement human trafficking protocol. And that's so important, that partnership together. Just last night, San Jose PD had a sex trafficking operation, recovered 2 foreign-born individuals. And the fact that we're able to have advocates come out, support those individuals, make sure that they have shelter, make sure that they understand that before going back to their home country, that there's other immigration relief that they can tap into, that there's support, that piece is so important. So I really appreciate everything that you've done to, again, increase that access, that advocacy access to survivors. It's just incredibly important. So thank you.
Bro, you're on
Sorry,
mute.
I was muted. Thank you. Yeah, sorry. Next up, we have Dr. Maria Hereyova. I apologize.
Hereniova, thank you. So thank you so much. So just listening that the report. So we have a medical protocol actually for our patients, and I just would like to know the time frame. Let's say we have to work with local law enforcement, and which can help us to determine whether and how forensic examination will be provided. So our medical protocol states that if sexual assault happened less than 5 days ago, of course we are offering forensic exam. If it's between 6 to 19 days ago or injury are present, we have to call our local law enforcement, and actually they are determining if a forensic examination is indicated. But if a sexual assault occurred more than 20 days, that means we should not offer any examination for this patient, or is this no longer? I'm not sure if you can answer. There is no evidence, so that's why we should not refer this patient for an exam.
If you don't mind, Councilmember Perales, I think I can help answer that question.
Thank you.
Thank you.
So, Doctor, one of the things that we've kind of gone away from is just the standardized days where it's 72 hours or less or 72 hours or more, and kind of taking a case on case-to-case basis. So I guess the best advice I can give to you, regardless of the amount of time, is just to report it to law enforcement. And if it's in San Jose, we make determination based off the evidence presented at the time rather than the amount of days that have passed. So I guess that's the best information I can provide. And that's both in pediatric SART examinations and adult SART examinations. However, the easy ones are when it's 72 hours or less, that is something that's more of a trigger, right? That's an automatic. But when we start getting beyond the days, there are protocols in our Santa Clara County protocol that have guidelines. However, that doesn't mean that we stick strictly to them. And that's one of the things that we've broken away from to try to get more survivors the medical attention that they need, not only for physical evidence, but for healing in general.
Thank you very much. And I was also wondering if this is included in a SART toolkit, because physicians look and read the SART toolkit, which was actually developed in 2018. So if we can, or it's probably, I'm not sure if it's updated or.
Yeah, the person, I'm sorry, Councilmember Perales, if I could just chime in here for a moment. Thank you. There are two things that I just want to say about this topic. I think that what we know is that we don't all have agreement exactly about how to approach this issue yet. And I appreciate very much Lieutenant Jimenez's point about, from a police lens, really having to look at the evidence that's available and then making the call. I think from a medical perspective, the medical side of this may actually have a very different perspective. And what I would just like to suggest is that instead of trying to resolve that here, because I don't think we will, that we actually put together a little bit of a working group to dive into this topic with both them, because I think this is one of those places where we're drawing distinctions based on the type of exam and based on how that exam is accessed, and there are many. And I'm looking just at Kim Walker, and I know we've been doing as a county in partnership with your agency a lot of work around even the strangulation protocols, and there's a medical and a legal side, and both have to be addressed. So is it all right with everybody if this discussion is something that we put on the to-do list to follow up?
Yeah, I think we
Chair
can.
Perales, is that okay?
We can add that into our recommendations at the end here as a to-do.
Great.
Thank you.
Thank you.
Great, thank you. Okay, and then next up we have Lindsay Mansfield.
Good afternoon. Thank you. I just wanted to really share my deep appreciation for the support that survivors receive from the City of San Jose and also the County of Santa Clara. I think the policies and thoughtfulness around survivors and the explicit support for our collaborative programming, it makes me thankful to be part of this community and part of these partnerships. I really wanted to also just kind of have a shout out for the co-located models, the CAC, the Family Violence Center, and SAIU. These have really been invaluable for us. I think it allows us to have quick ongoing communication that's necessary around service provision. It gives us a deeper understanding of each of our roles. And as was shared by Anjali in the presentation, we've greatly improved the referral processes that we have. It's working, right? There's a huge influx of referrals, a lot of connections to services. And I just look forward to continuing this work and continuing the work of the domestic violence high risk response. I'm proud of our community. Thank you.
Great, thank you. And a lot of positive feedback, which I think is just points to thank yous that we owe to all the hardworking individuals that are there on both sides, on all sides really, on both the county, the city, our nonprofit partners. So thank you. Okay, that's all the hands that I see. So Supervisor Chavez, I'll hand it back to you for the last item.
Great, thank you. And I just wanted to say amazing work. And I'm sure everybody's going to be copying your homework, San Jose PD. That was a lot of really good detail and a lot of really good opportunities for training. So thank you. And Sylvia, as ever, thank you, thank you, thank you. And I'm really to the entire city, just exciting the and excited to be partnering with all of you on it. So the last item we're going to hear is to receive a report from the County of Santa Clara's Office of Supportive Housing, the City of San Jose's Housing Department, Destination Home, and Community Solutions relating to housing option opportunities available for survivors of gender-based violence and child abuse. And I just want to highlight that a big piece of this work coming before us is that it was an area that that we had talked about at the last two hearings, but we just hadn't wrestled to the ground. And I know that this is an area of high interest on our board as well, as I see Supervisor Ellenberg ready to jump in. I also want to say that we're really honored to have Tiffany with us, who is a survivor and will be our first speaker on this panel. She'll be followed by the county's supportive housing, City of San Jose's Destination Home, and Community Solutions. And Tiffany, we're really honored that you could join us today.
Thank you very much for having me. I appreciate it. I do want to share my story. It's very emotional, so please bear with me. June 2019, I walked in on my youngest son being molested by his stepbrother, doing unimaginable things no parent should ever have to see and no child should ever have to experience. I lost it, as any mother would. And my daughter came out and said it's been happening to her too. My stepson was removed from the house immediately, and we tried to make it work, working with counselors and Community Solutions. But it got really bad at home between my fiance and I because of what had happened. And I had no choice but to leave my home that I thought was my forever home. And so I left, and I was put in a hotel. I was very thankful. I went from one hotel to another hotel and had to pack my kids up each time. And it was really, really detrimental to them and myself. My children missed a lot of school because they didn't want to go. They couldn't concentrate on school. It was too much in their mind. And me, it was so much on me because I was not concentrated on their mental health, because I had to figure out what the next step was, where my children were going to lay their heads at night. Luckily for Community Solutions, they got me and my children into a shelter, but it was only a 3-month program. And I had to work every single day and still try to drop my children off at school. But I missed a lot of work because I had to go canvassing and looking for apartments and trying to find something in my budget. And my budget is I work as a preschool teacher, and assistant director, and I only make 15 an hour. And after taxes, I bring home about $18.24 a month on one income. And I found a place, finally. I could not afford the deposit. Community Solutions helped me. And it was 1904. I had to have a friend lie and sign an affidavit saying she pays me a monthly amount just to qualify for the place. And luckily at that time, my credit wasn't that bad, but over time, going from one income or two incomes to one income, I lost my car that was in my fiance and my name. It got repoed. I started accumulating a lot of debt because of credit cards we shared, and I started going under. Like I said, $18.24 a month. My rent's $19.04, and that's low income apartment for a 2-bedroom apartment that I share with my 3 children, 2 males and 1 female, and all 3 of them have to share the same room after being sexually molested. I have looked multiple times for places that were bigger, that were less money, that me and my children could move into so they could be separated, so we all could feel safe. But with credit, I can't find anywhere. With my income, I don't qualify. There's nothing for my budget, nothing. You have to make 2.5 to 3 times the rent, and I don't make that. I don't make that. So it's been a major, major challenge, and we haven't had time to concentrate on healing, except for the last maybe year. And this happened almost 2 years ago. And just now we're very barely scratching the surface of what happened to my children through counseling. And now we're at a point where eventually we're gonna have to find somewhere to go again because mom can't afford it after what happened to them. And that's something that they don't need to endure more of. And really neither do I, because I have to concentrate on their healing and my healing. And with not being able to have a stable place for my children and I and a long-term program, we don't get to concentrate on healing. We have to concentrate on what's the next move. Where are we going to lay our heads next? And it's very detrimental to all of us. And, you know, it just comes to a point where I feel that people in our situation and my children's situation, we need more stability. We need bigger and longer programs to where we're concentrated on mental health and healing and not concentrated on losing our place to live, not being able to find a place to live, my children worrying of homelessness, not wanting to go to school because they're afraid of what their friends might think. And it's just, you know, I just feel we need bigger programs, long-term, 3 to 5 years, you know, easier transitions going from a traumatic situation of being molested to a program right away, not hotels and then shelter and not knowing next step. No, we need 3 to 5 year program where it's either an apartment that we can stay at, lower income, Section 8, something, so we don't have to worry about where we're going. And having programs to help build credit, because I can't build my credit. I can't pay off my bills. And that's something that's preventing us from getting a place too. And so just programs that will help with getting us back on our feet, really, and long-term, not short-term, where we're suffering emotionally about where we're going to live. Thank you for having me.
Tiffany, thank you so much for sharing that. And I'm sorry that both for the pain your children went through, but for you as well, and really appreciate you taking the time to talk to us today. Thank you.
Thank you.
I think I am supposed to go next, and we have a presentation. Tiffany, thank you for your words. You're so brave. You're so brave, and I'm so sorry that not only this happened to you, but that the solutions haven't been adequate. And I think it's a perfect segue really to this conversation. And what I'd like to say just in terms of centering this is what Tiffany was asking for was permanency. She was asking for a home. She was asking for a place to live. She wasn't asking to sleep in her car. She wasn't asking to stay at a sanctioned camp. She wasn't asking to stay somewhere for a couple weeks. She can't afford a place to live. And so when we think about solutions for domestic violence survivors, for frankly, almost every woman who experiences homelessness, who has encountered some sort of domestic violence or sexual abuse or assault, safety and justice is what our families need. And the most important role as elected officials is in vigorously pursuing permanent solutions. If there are not Measure A projects in your district, there should be. We should not be putting temporary solutions over permanent opportunities. And this is the role that you play that is so unique that none of us can do. Supporting projects, asking for help in working with communities or neighbors who are resistant. There's an article that just popped up just while this session was going on about the Pedro Street project and how there will be potentially more delays. It could be almost 100 people off the streets that has been ready to go and that we're waiting. This responsibility to create permanent housing for the lowest income folks in every district, this is up to us. So as you listen to this presentation and you will hear what we are doing and the work that is happening, know that it all lives and ends with a place for people to go, with a door that locks. And pushing these projects forward is the most important thing that we can do. So the next slide, I'm so happy to present. Not only we had Tiffany, but Aida from Community Solutions, Jackie Morales-Ferrand, Director of the Housing Department for the city, and Consuelo Hernandez, the Director of the Office of Supportive Housing. I'm so happy to be joined by these women who can talk more about the work that's happening. So Aida, I'll turn it over to you.
Jennifer, good afternoon. And thank you, Tiffany, for sharing your story with us. I really do appreciate it. I'm hoping you're taking a deep breath and know that we're here to collectively think of ideas on how to move this conversation forward. So I'm going to share with you some of the challenges with sexual assault and housing. So prior to COVID-19, our sexual assault clients, funders would only allow us to have 3 days of emergency hoteling after fleeing their homes due to victimization. Only if you had an intersection with domestic violence could you come into our shelter. But I have to say that, and I want to acknowledge the partnership that we currently have with the Office of Supportive Housing. We have been able to use some of our budgeting money in our housing contracts to be able to extend hoteling for all victims of gender-based violence, including sexual assault. So that has allowed some families to become a little bit more stable. It's not nothing that Jennifer alluded to, which is permanent housing, but at least be able to work through the system. Because during those first few weeks, there's a lot of things going on with law enforcement and, just getting folks to SARTs and what have you. So there's a lot of things happening. So we have been able to extend that for a longer period of time, at least allowing families to process the crime that was committed against them or their families. And so one thing that I also want to point out is that COVID-19 has amplified the housing prices and definitely the lack of affordable housing. We have more and more families moving into roommate situations. And so what does that mean for some of our families? It means that we've seen an increase in incidents of sexual violence that occur amongst roommates. And because of this, they don't qualify for emergency shelter because they are not intimate, it's not an intimate partner violence crime. And so I just wanted to point that out, that more and more families are moving into this. And I just saw an article come through last night that in order to live in this valley, you have to earn $38 an hour to afford a 2-bedroom apartment. So I thought it was a really interesting fact right before this presentation. Can we go to the next slide? And so this is the current snapshot of sexual assault victims with Community Solutions. So currently we have 140 survivors receiving services from us. Of those 140, 60 or 43% involve cases with youth under the age of 17. Of those 140, 24 or 40% of the cases, the parent or the survivor has experienced intimate partner violence. Next slide. And so many parents have to, as Tiffany mentioned, they have to try to normalize their lives again and stabilize. And so what that means is really finding income, improve skills to be able to find a higher paying income so they can afford in either an apartment or a roommate situation. But many folks, because the trust level has been shattered, don't trust people to care for their children. There's not affordable child care out there for them where they can feel safe that they drop off their children. So that really impacts their ability to earn and qualify for even a roommate situation or apartments in this area. The other thing that we're finding is that adults who experience sexual assault don't have a place to go. They have to go to homeless shelters where they're sharing the shelter with other homeless individuals, which then increases the risk. It puts them at a higher risk. And so we're noticing that there's nothing for adults for them to go and be safe and feel good and feel ready to be able to heal. Next slide, please. So between January and December 2020, we served 105 homeless gender-based violence survivors. Out of that, 19% were victims of sexual assault. The other were either domestic violence or human trafficking. And so for us, it's extremely important that we come together to collectively respond to policies and serve and support survivors from crisis to long-term sustainability. And so this is our model. We go through the crisis, which is the first 24 hours immediately attending to those immediate needs, including where are we going to shelter them? And then we work with them within the next stabilize. Let's figure out some goals. Let's figure out what we're going to do together. And then really the ultimate goal is really to move them forward to permanent housing. So the ultimate goal of our model is to break that cycle of poverty and the cycle of violence. We have to be working together to do that. And so before I move forward before Consuelo starts speaking, I just want to say that it's extremely important that we consider building and really working on developing and maintaining, sustaining the human asset. There's so much going on with our families that they need some time to heal. They need stable housing. They need a platform, and stable housing and affordable housing is that platform from which our families can really spring off to bigger and better things for themselves and their family.
Thank you, Aida. Consuelo Hernandez, Director, Office of Supportive Housing. Good afternoon, everybody. I wanted to start this portion of the conversation by just sharing with you our approach. So we looked at existing recommendations, including CDAW, the recent Human Trafficking Commission recommendations, which include 65 recommendations, 2 of those which involve housing. And so what you'll hear next is a summary of our supportive housing system, how survivors are served within this existing system, how they're served directly by victim service providers, housing policy that's in place to protect survivors when they're in circumstances of instability in housing, the opportunity that Measure A presents to solve this, and then some recommendations that we have, again, based on things that we have seen through other bodies, but also some that we came up with our own. So the supportive housing system, the intent here is to provide permanent housing, critical services through different types of interventions. We serve people from those that are elderly to those that are survivors of gender-based violence. And I apologize, I also forgot to mention that we worked with the Office of Gender-Based Violence Prevention in formulating our recommendations and discussions. And actually through those conversations have now formed a new partnership with City of San Jose's Housing Department, our office, and that office to think about ways that we can work together a lot closer. So what I have for you is a few data pieces, because the work that we typically do in our office and the way that we approach problem solving is, what is the need? What is the demand? How are people getting served? How do we identify gaps? So the table on the left here shows the inflow of survivors into homelessness over the last 3 years. And on the right of this first table is the number of people that were placed in housing that self-identified that there was an occurrence in the past year of domestic violence. So you'll see that the inflow in calendar year 20 went down from prior years, and that isn't necessarily a good thing. It's actually a result of COVID and everything that Aida mentioned, that people were more likely to stay in their situation than they were to seek assistance. And we still managed to place 230 people into permanent housing that, again, self-identified or self-reported a domestic violence occurrence. But I did just want to highlight for you that the drop has more to do with the fact that the pandemic created different situations for victims. And the enrollment numbers on the right, we wanted to share with you that people that were enrolled into a housing program where they were receiving services to help us understand where the need is depending on the intervention type. And also wanted to share a couple of facts that we heard from our homelessness prevention system, that we did see a drop in the number of people that were seeking homelessness prevention. It significantly reduced to about 32%. That again is because of COVID and the situation that survivors found themselves in, and really just seeing that people were identifying other means of need and not necessarily reporting that they were in a domestic violence situation. This one is an analysis of the services that are provided through a victim service provider. This is in addition to the services that they are receiving directly from our office. There is some overlap, and we are working together with the DV Collaborative to find ways that we can report our data from a housing perspective in a consistent manner. And you'll see here, as Aida mentioned, over the last year, they were able to provide people with additional hotel stays because of the pandemic and because of the flexibility in being able to house people for longer periods of time in hotel rooms. And what we really wanted to highlight today is, what is the current need? In our current homelessness system or supportive housing system, a little over 1,000 people self-identified as having had an occurrence of domestic violence. Of those, 358 are currently fleeing. And what we're seeing, and it's very similar to what Tiffany mentioned today, is that people need, survivors need permanent supportive housing, because typically a household in a rapid rehousing program would be able to feel better, get the assistance that they need, and be able to transition over a 2-year period. But what we're finding is that 77% of those that are identified as having an occurrence of domestic violence are really looking for permanent supportive housing. And the difference here is that the permanent supportive housing program and the elements around it give people a longer period of time to have services, whereas rapid rehousing is limited to 24 months. And this helps shape the type of housing that we build, the types of programs that we develop. As Aida mentioned, because of the pandemic, what we found was a need to lengthen the time of stay that people are enrolled in any program. During the pandemic, HUD did issue a number of waivers that we were able to use that basically extended the time period in which a person can be enrolled. So typically we have very limited opportunities to extend the person's enrollment in a program. But because of COVID and through the waiver that HUD offered, we were able to work through our contracts to extend those services over that 24-month period. As I mentioned, the opportunity that the housing bond has to offer is the number of developments that are under construction. This is the latest report that we have to show you. This is our progress over a 4-year period where thanks to the leadership of Supervisor Chavez and the balance of the board and continuing to support the funding of supportive housing across our county, that we have now funded and dedicated funding a little over $530 million over 7 cities for 3,000 apartments or so. And while the units aren't necessarily dedicated to survivors, there is an opportunity for us to work together and identify ways that, in addition to how they're being served in our system, what are some of the elements from a design perspective that these units should have? Last year, we convened a meeting with stakeholders to try to understand what some of those amenities include. Childcare was a big one. And we are looking at a rapid rehousing program that allows us to leverage our rapid rehousing enrollment and enrollees and having them provide childcare for friends or clients that might be going to work and there's somebody to stay at home with the children. And we also did want to highlight the Violence Against Women Act. The following slides just show you the history of the act. There's recent conversations at the federal level about extending this and making some modifications, but wanted to show this here because what our office has been doing and what a lot of the cities across the county have been doing is making sure that the VAWA language is included in all of our affordable housing developments, in both the application, in the way that they manage their properties, because those protections are there in place. And the law basically allows us added protections so that if we have a victim in a specific unit, that they are not, that they are protected from instability. For instance, if we have a member who's not the head of household or is not on the formal application for that unit or enrolled in that program, that there's sufficient time for them because of the VAWA protections that allows them a period of time to become eligible for the unit or to become eligible for that program. And it's a lot of information that people don't know across our system. And really it's how do we use our partnerships and leverage that as an education opportunity. And just again, highlighting some of the definitions, which was reauthorized in 2013 to define that an abuser is no longer required to be, the perpetrator is no longer to be a spouse. And then the final ruling is that even though some projects are not subject to the requirements, that all types of housing have some level of protection, and that through our system, we look at this lens to make sure that we're looking at every opportunity to protect victims in case they're in a situation that is not safe for them. And with that, I will hand it over to Jackie.
Thank you, Consuelo. So first, I did want to thank and appreciate Tiffany for sharing your experience really for our benefit. And I'm sorry that our system failed you. What Tiffany described really is a housing first approach. Ideally, we don't want to put anyone into a shelter, but we want people to go directly into permanent housing. And I think Tiffany made a great case for why that is so important. But we understand that it takes us time to build the permanent housing. I'm sure Consuelo and I are quite frustrated right now with how our tax credit program is going in this state, which is preventing us in the Bay Area from receiving the tax credits, which is further delaying our ability to move some of these projects forward. So we do recognize in the interim that we need to have some short-term responses. So one of the first recommendations is we know there is not a homeless shelter just for women or female identifying individuals. When you see the statistics between 7 and 11% that are self-reported as domestic violence, being a survivor of a domestic violence or sexual assault, we really need to have a safe place for women to go. And it is not unusual for a community of this size to have a women-only shelter, women-only programs, where women can go in order to feel safe for them and their children. We also are recommending that we have longer term facilities for women and their children who are fleeing sexual assault for at least up to a year. And maybe, thanks to Tiffany, we should extend that time period. Again, trying to be mindful of what that transitional period should be. And that whatever we create really needs to ensure that it's can meet the needs of both the adults and the children that end up living there, including having daycare services. In order to stabilize children and family, we realize we have to provide daycare funds in our housing programs to allow women and children opportunities and access to more fully participate and to get jobs and to maintain their jobs, and perhaps do more creative linkages between our residents and daycare providers, and that this might be a way of even supporting women-owned businesses. We also are recommending an additional more money for daycare funds in our housing programs to, again, create that broader access and pathways for the daycare provider. Next slide. In order to implement, and I think to explore more recommendations, we are going to create a work group to identify what we can do on the housing side, the housing first side, the permanent supportive housing side. And we are going to look at, and we're going to have community-based organizations, the state, the city and county partners, nonprofits, people with lived experiences to work together for us to create a plan so that we can really open up the housing that we already have and ensure that it's working to meet the needs of this particular group. We know that the system right now definitely has its challenges, but we strongly believe that by working together with the housing groups, working with the nonprofits, and again, everyone else we listed, that we can create a system that can actually work for this particular group. We've been successful at it. The city and the county Destination Home have been successful in creating these partnerships, and we feel that by working together, we can do this for survivors as well. And so with that, we are open for questions.
Thank you very much. I will see if there are any comments or questions from my colleagues. Seeing Sylvia? Yeah, go ahead, jump right in.
Thank you. I want to thank everybody for their presentation, and Tiffany for allowing us to be part of and sharing her experience, and also be a part of maybe addressing some of those gaps in services and the lack of continuity and stability for her family. I don't know how we all kept it together, but I was crying inside. She is such a strong mother to continue on with her children, and I'm grateful that she shared with us. And so thank you so much. I don't want to gloss over any of that, because that is a tremendous life experience that she shared in a matter of a couple of minutes. And it was really poignant for what we just heard next about housing. I'm really just flabbergasted by the amount of money that that the county is committed for housing. I want to take a moment to just thank our Jennifer Loving and for your leadership, and always just so passionate about our unhoused community and understanding the needs of everybody, including sexual assault and domestic violence related intimate partner cases. And Jackie Morales Ferran, our director of housing, for some of the work that she's been doing that she didn't actually mention here, but I'm gonna share with you some of the work that she's done because I think it's important to connect all the dots. And every time I've asked Jackie for some funding around families, she has never said no. When we needed diapers and wipes and calming kits, she found money in her end of her neck of the woods for $500,000 to make sure that our families receive that. She also made sure upon my request that we had about I think $1.5 million housing for sexual assault and domestic violence families. And then when I asked her for childcare, for another $1 million for childcare, she said yes. So part of our addressing the families who are in a gap, who make too much for federally funded programs, but not enough to be able to afford childcare on their own. And so Jackie said yes once again. And so I'm really grateful to you, Jackie, because you understand the correlation between overcrowding. You understand that these perpetrators live in the same housing unit, and in our zip code that we share with Councilmember Carrasco and Esparza 95122, the same number of people in that zip code, this is how overcrowded it is. The same number of people are living in that particular zip code in San Jose, or the same number of people living in the city of Gilroy. So, that really paints a picture in terms of how much overcrowding and how we lack affordable housing in that particular area, especially in my district. There aren't any the naturally occurring affordable housing is the one that our families create for themselves. And unfortunately, a byproduct of this crime of opportunity, which is sexual assault. So childcare and housing are absolutely part. We've heard part of the infrastructure, and and I've have to absolutely thank Jolene for your leadership in this. I remember when I worked for First Five almost 10 years ago, and I worked for 10 years there. Childcare providers were always at the heart of the work that you were doing, because you understood their role in the safety and well-being of our families, and the social learning that happens for our children. Family is the most important vehicle, and if our families aren't stable, that social learning at that very early age is just not happening. And and just the brain development with the stress levels, it just is so impactful for our children. And so I just want to thank you, Jackie, so that I know you understand this, but as you've seen and delved through all of what we've been doing around sexual assault, I know that you will continue to be my partner in this, and hopefully continue to say yes on the request that we have for our families. But I don't think that I have to even convince you. You've already been a partner. So I just want to really thank you for that, for your leadership and your willingness to walk with me in terms of family-friendly housing and childcare for both sexual assault and domestic violence impacted families. And then Councilmember Carrasco, for your leadership for families that have that domestic violence impact. Of course, with your experience, how children can't concentrate at school, and they can't contribute if we are not there to support them with all of these systems. And so I'm really proud of everybody who's around the table here, just contributing in their field of expertise to what we see as our next generation of children. And so I just want to thank all of you women, Dr. Dewan, all of the wonderful work that you're doing in the Santa Clara County Office of Ed, and Lindsay Mansfield, you're our advocate from YWCA, and you show up every month almost at our PSFSS meetings. And I know that your presence there means that you're also going to all of these calls when crisis occurs. And so thank you for that. But I just wanted to make that point in terms of that correlation between housing and sexual assault. I think you heard from our last presentation with our police department, the number of incidents that happened in the home or that involved a family member was absolutely high. It's the biggest number. And so we have to address housing at the same time we address sexual assault and domestic violence and child abuse. But you all already know that. So thank you for the work that you're doing. And I hope that in our following conversation, when we talk about the sexual assault study, that we all contribute together to figuring out how many kids that have a sexual assault or sexual abuse had a prior case of sexual abuse to that, so that we can also understand, our police officers can also help understand that they need to be integrated into a system that can support them, such as the Children's Advocacy Center, because they're more than just an exam, they're really a lifeline for our families. So this was really a comment rather than a question for our presenters. And so, and just a tremendous gratitude for Jackie and Jennifer Loving for their leadership.
Thank you, Council Member, for all your good work. Magdalena?
Well, I'll just be very general and thank everybody, because there's just too many names and too many great folks who are doing amazing work. And I think there's been a lot of thank yous that have been parceled out. So thank you to everyone who has brought us together. And it is a dream come true. I'm just compelled to say just a few words after Tiffany spoke, and I don't know if she's still on the line, but like Councilmember Arenas said just a minute ago, I'm sure that you have to be stone cold not to have had your heartstrings pulled by her heart-wrenching account of her experience, and it threw me back to when I started in the field of foster care and adoptions over 25 years ago. I was very young when I started in social services. I'm going to say I was a very impressionable, but I was, and so and it was very hard work. It was very, very difficult work, I have to say. And so I think what bubbled up for me as I was listening to Tiffany, besides everything that has already been said, and I don't want to be redundant, but I think I just want to emphasize the following. We know that when we have healthy mothers, we have healthier children. And I know that to a certain extent I'm preaching to the choir, but I don't want this to be lost in all of the conversation because my heart is just broken right now just from listening to her. So we know affordable housing, permanent housing, a safe home, we need all of that. We also have to make sure that we have a safe place and a soft place where moms can land. And when our children are hurt, moms take the brunt of it as well, even if the mom is not the one that's enduring the abuse, but the mom is just as broken as the children are. And so to be able to find the resources and the support and make sure that there's a community that embraces mom and puts mom back together so that she can help put her children back together, I think it's just as imperative. Besides all the other pieces that we were just talking about, I just see the heartache in Tiffany, and I can relate to it just as a mom, even though I've never experienced anything remotely close to anything like that. And so I will say this, for those of us who have experienced a household where we're single moms, even especially we have small children, thank goodness mine are teenagers and one just turned 18. I've got mixed emotions about that, but at least he's kind of an adult, I guess. You know, but I can run to the store and be very comfortable for a little while, knowing that I can run to the store. But a single mom of little ones, especially after trauma like this, she doesn't have the kind of luxury to run to the store. So I guess what I'm saying is everything gets amplified 1,000 times and becomes so much more difficult and so much more challenging than it ever has before. So you take a woman who had what she thought was her life all put together, a fiance, a loving home, and then an event that just blows everything up. And now you're a single mom in transition, temporary homes. You can't even run to a store for a carton of milk. And so just keeping all of that in mind, and now a single mom, it's just so incredibly overwhelming. And I just heard it in Tiffany's voice. And so as we think of finding permanency and helping moms get their lives back together, ensuring that in these homes, in these developments, that we have all of the services intact to help moms rebuild their lives. And that includes credit rebuilding, that includes figuring out how to establish financial security, that includes how to find a community where mom can run to the store and get that carton of milk, and knowing that her children are safe for those 15 minutes, whether it's that childcare in that moment on that first floor, but being able to go on with life and rebuilding it. So I just wanted to say that because so much is just blown up in that instant, and gets so very complicated for moms. But I want to thank everybody for all of the work that they're doing. And you know, my heart is feeling very heavy right now. Yeah, very optimistic, but at the same time, just feeling very heavy because I know that we have a lot of work still to do. And I know that that there's a lot of lives that we still need to help in the process. But I really want to thank everyone, because this is a dream come true. Having the county and the city collaborate in such a magnificent way, it's saving lives, and it's helping children get into a place that could potentially be so incredibly harmful, and being able to get into a stabilized home, a permanent home that can contribute to their future and really break that cycle of violence and abuse is priceless, as the commercial goes. So thank you to everybody's leadership and commitment to this. It makes all of the difference in the world.
Thank you, Councilmember Carrasco. Ms. Erin O'Brien.
Thanks. I want to join in thanking Tiffany for sharing her story, because I think it takes incredible bravery to come and tell your story. And when we hear those stories, they impact us in a really visceral way. It makes it real in a way that numbers can't. But what I just want to say to you is, behind the numbers that have been shared today, there's another family that's dealing with that kind of trauma. So how, you know, the urgency with which we must act is incredible, because behind those hundreds of people, there's families that need our help, and they need it quickly. So I really appreciate everybody pulling together here. I'm very grateful for Tiffany for making very real for all of us what truly does happen to families. And I'm very hopeful that we're going to make a really big difference yet again.
Thank you, Erin, and thanks to your whole team. You've been amazing, amazing partners. Matt, Councilmember Mahan.
Thanks, Supervisor. Yeah, I'll also add my just heartfelt gratitude to Tiffany. That was, I mean, I think as Erin just said, I think you know, sometimes a personal story is worth, you know, worth more than any amount of analysis or philosophical musings. And I think Tiffany's story really gave us that personal insight and empathy. And I'm very grateful, as I know we all are. So I don't know if Tiffany's still on, but thank you. You know, I'll also say I think it's great to see the level of kind of cross-government, cross-sector collaboration here today. I think all of our residents benefit when we partner closely, and this is just really beautiful to see. I didn't have a lot of questions. I feel almost, after making that point, almost petty to get into the sort of the tactical questions, but I think just to Erin's point about urgency, which is what's been on my mind throughout this third presentation, I am interested in hearing a little more about the next steps of the working group, if possible, and just if I don't know that we have more information at this time, but I'd be really interested in any timelines or milestones when the group might set kind of success measures, and probably premature, but curious to know. You know, I couldn't quite, I might just be slow at math, but I couldn't quite get on the numbers point exactly what the gap is in need, and whether or not we think within the Measure A funding we can leverage enough funding to maybe meet that need, or if we're going to have to look at other revenues. So I know I'm getting into details, but I guess I feel very eager to start moving towards some bigger and better solutions for more survivors. So I'll leave it at that, but curious if there's any more detail we can share at this time.
Thanks, Matt. And I'll see if Consuelo wants to answer that. I will say that after we take public comment, one of the things I wanted to do was just run through each of the items and frankly set some goals. And one thing that you'll note is that, and I think this is, Matt, your first meeting with us in this regard, but one thing is that for each of these hearings, one of the reasons that we ask the staff and our community leaders to come back with recommendations is actually so we can assess those recommendations and then come back with solutions. So I appreciate your bent toward detail. I share it with you. So why don't we do this? Let's go to public comment. And oh, I'm sorry, Consuelo, do you want to respond to that if you have an answer yet?
Thank you, Supervisor Chavez. Just wanted to add that we have scheduled our first working meeting for May 26th, where we will be talking a bit more about the recommendations and how we work together and how exactly the housing programs from a housing development perspective align with the housing services, which we didn't cover, Councilmember Mahan, we didn't cover the housing services perspective. We really were just looking at housing development opportunities.
Great, thank you.
Thank you. And so I'm going to ask our clerk if we could give each of our public speakers 2 minutes, and then we'll come back to the board for action, or to the whole board, all of you, y'all. All right. All right. So I'm going to, if you could hold just for 1 minute, we have 5 speakers, so we'll go to 2 minutes. Let me just confirm that. We have 6. Let me just see if we could get everybody who's interested in speaking to go ahead and raise their hand. All right, we'll give each speaker 2 minutes. Thank you.
Our first speaker is Catherine Campbell. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you so much to the supervisors and council members who are here today. I wish we had 3 minutes with only 5 people and a 3-hour meeting. But I do want to say you had me in tears listening and watching the video of the CAC, and the stories are amazing of what children go through if they don't have that. We have to remember, though, that we have a culture to dismiss abuse. And even though we have this amazing, beautiful center, and I'm sure disclosures will rise and there will be more who will substantiate these, our county only substantiates 10% of the child sexual abuse. And that means if there's no disclosure, because they're not able to at that time, in this beautiful center, and they can't disclose, those people go to family court and you have an 85% chance of losing custody to the abuser. So not only are you worried about housing, you're losing all your finances and your stability, your children have to live full time with their abuser. And that is a powerful situation that we're putting people into to not aid them. And we have, we have the power to prevent that. So I'm asking for everyone to look into the institutional courage steps, because our culture to dismiss abuse needs to end. And I so appreciate this. I mean, honestly, you had me in tears watching this. One quick comment is that when we have the video showed the officer in uniform, I certainly know in my case that was a misstep to show have an officer in uniform. So I hope there's no uniformed officers there. Thank you so much.
Our next speaker is Scott Largent. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon, everyone. Scott Largent. I find it kind of strange that we don't have a women's homeless shelter. That was kind of you would think I would know this by now. I actually thought we did, which is pretty strange. Most of my comments are about women that are escaping sexual assault and domestic violence that are basically living in encampments and living on the streets. It is very, very hard to watch this play out. And especially where I stay at down in the FAA crash zone area, kind of near the county building. Women, children parked in cars and just kind of riding things out. And it is, it's just very sad. What I am wondering, actually, let me just kind of tiptoe off of this real fast. It's the same thing like with our psych ward. When you mix the men and the women, the men just prey on the women in there. And I went in there as I was I guess a patient for 4 hours in there one time. And it was just shocking to see that happen. The women need to be protected. The men don't need to be around. And it seems like that needs to be in shelters. It needs to be in psych wards. And, I like what one of the council women had to say is putting mom back together. Anything from, like fixing the credit to providing a place to stay, even women's self-defense or even a can of pepper spray, whatever it's going to take for her to be okay. I just worry there's no place to go right now. And we're not putting something in, just a temporary, even a sanctioned encampment for women or survivors of domestic violence. I mean, that would be fantastic, but it's just not there. So thank you.
Our next speaker is caller ending in 367. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Yes, my name's Lillian from District 6. I'm commenting on 2 items. One is the VAWA, which is in the partnership with housing. When you talked about that or spoke about that in 1994, these were implemented, 2005 and 2013. So obviously these are laws that are on the books already. And I hope that when you have your working group, you revisit those in partnership with those so you can give safe haven to those families that are in domestic violence and sexual abuse quandaries. And the second thing that I have is seniors. I will be 65 in August. I'm a senior, and I know that quite a few seniors are on our streets homeless. I don't know the percentage of those that have been in domestic violence or sexual abuse circumstances, but I assume that those are also high. So today we talked about, from what I heard, were families and young people and children, which should be our first priority. But let's not forget our seniors who have been very vulnerable in the COVID-19 era and have been very, very high on the risk for mortality. So please address that also. Thank you.
Our next speaker is username A. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Moving forward with this progress, where do survivors and victims go, and who do we contact to be a part of the working group, planning and education that improves the current state of the system, the protocol, and how we administer these practices to truly be more trauma-informed and aware, and more importantly, effective in aiding current and future victims in obtaining a true sense of health and safety away from sexual assault and domestic violence, knowing all too well that outcomes can be greatly aided or adversely impacted by the system that is represented by authorities present here today. It seems imperative that what is seen as multidisciplinary should equally be community-oriented in stakeholdership, where survivors and victims play a strong part in informing and shaping the system with feedback of what works and what doesn't. Big congratulations today, but I must underscore, the system and training and approach currently has huge gaps and loopholes. Children and our most vulnerable are falling through the cracks and at times made worse having gone through trying to get help from individuals working in the outdated system. CAC is a big step. Discussing homelessness, housing, and sexual assault is a big step. It's time to learn from survivors and current victims, having a seat at the table and being a part of the planning and execution pie, not just county and city, cross-government, cross-sector, but county, city, and community.
Thank you. Our next speaker is Erica Wiley. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon, committee members. My name is Erica Wiley. I'm the School-Based Prevention and Outreach Program Manager at YWCA Golden Gate, Silicon Valley. We provide sexual violence prevention education to students in grades K through college in San Jose and throughout Santa Clara County. Our programs dispel myths about sexual violence, promote healthy relationships, examine gender roles and how they relate to violence, and explore how each of us can become empowered to end gender-based violence in our community. Our goal is to teach young people in an engaging, age-appropriate way to recognize, respond to, and report abuse. One program in particular that we provide is our Shifting Boundaries, Lessons on Relationships for students in middle school. Shifting Boundaries is an evidence-based multi-level prevention program on sexual harassment and precursors to dating violence. This program is unique in that it embraces an environmental approach that identifies multiple strategies to support youth, both school-wide intervention and classroom workshops. During these workshops, we discuss topics such as consent, how to set and respect boundaries, sexual harassment versus flirting, and how to safely intervene in harmful situations. As a survivor of sexual and domestic violence myself, I know the importance of engaging youth in these conversations and giving them the tools and knowledge to help make safe decisions for themselves and for their peers. Now I'd like to share a quote from one of our Shifting Boundaries students. When asked what they liked about the Shifting Boundaries program, the student responded, "I like how they taught us ways on how to stand up, and they told us other ways of harassment or assault that I thought was normal." This is from an 8th grade student in the Evergreen School District. With that, I'm asking for your thoughtful consideration and continued support in sexual violence prevention education programming. Thank you.
Our next speaker is Vanessa Torres. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, good afternoon, committee members. My name is Vanessa Torres, and I am the Community-Based Prevention and Outreach Manager at your YWCA. I'm also the mom to 3 very young children. I live in District 6 too. I understand and fully support the need to act now to continue to provide intervention services and resources to adult and children survivors of sexual assault, but today I'm going to talk a little bit about preventative services. I've been with the organization for nearly 2 years, and through my short time here, I've been able to see what a difference sexual violence prevention education can make in a community. We provided over 80 presentations to the community regarding sexual assault issues, reaching over 1,200 community members during a pandemic. Through our school-based prevention and community outreach education programs, participants learn to identify sexual violence, understand boundaries and affirmative consent, learn how to become safe and active bystanders, and learn about YWCA services, further empowering participants with both knowledge and choice. It's important to note that our prevention education isn't just geared towards adults. We work with community members of all ages, including parents, caregivers, educators, and children as young as kindergarten, all the way up through college. Your children and my children are the future of this community. To one day live in communities free of violence, we have to be willing to invest in education that includes sexual violence prevention. I too am asking for your thoughtful consideration and support in sexual violence education programming. Thank you.
That concludes our speakers, Madam Chair.
Thank you very much. Thanks very much. And I just will say to Catherine, I appreciate this was a long meeting and I had 6 speakers, which is why I did 2 minutes. But I do appreciate that this was a lot to digest and not a lot of time to give feedback. I will say that to those who are interested in playing a greater role, who are listening to this or watching this online, that you can reach out, I think, to any of the offices of the elected officials who are here today, and we'll find a way to connect you. And feel free to reach out to my office directly. I'm sure I volunteer to everybody because I know they'd be fine with it. So thank you for that. What I'd like to do now, if it's all right, is I want to talk through, we had a lot of information that came before us, and I want to walk through Supervisor Ellenberg, what I'd like to tee up for the county on the county's side of this. And then if it's okay, I would love to get your feedback on that. And then I'll turn it over to Councilmember Referrals to do the same for the city. I do just want to say, again, a very sincere just thank you. And I'm really filled with gratitude. And I know it's hard for staff to hear when we say we're filled with gratitude. Now here's the next thing we want you to work on. But I do also recognize that for many of you, this is part of your mission. It's part of what you wake up in the morning thinking about, and really how to make the world a better place. I do just also want to acknowledge Clara Collins, who is the director of our Office of Gender-Based Violence. And that's also a place that if you're interested in getting involved, you can reach out to Clara Collins and our Office of Gender-Based Violence for Santa Clara County. And you can Google that and you will find her. She's amazing. So let me begin with each of the items. So I'm gonna start with 2A, then Supervisor Ellenberg, if there are thoughts or feedback you have to that, I'll stop and hear that, and then go to 2B and then to 2C. So first, for 2A, this is the feedback on our Child Advocacy Center. I want to make a couple of requests, and one is that the Office of the County Executive agendize a discussion as part of the May budget workshops and provide the needs assessment, cost and sources and options for funding for the following: 2 contract child forensic interviewers for the Child Advocacy Center, including information relating to the possibility of cost sharing with not just the city of San Jose, but the other cities in the county that will also be utilizing the center. The addition of 3 deputy district attorney positions to address the rise in sexual assault, and so that we have evening and weekend coverage. Adding an X-ray tech and 1 clinical lab scientist to ensure the proper utilization of the X-ray machine, and frankly, to make sure that we don't have to move children from that single location. And then getting an assessment of medical positions to address the increasing number of medical and forensic exams at the Child Advocacy Center. In addition to that, I'd like to ask the Office of the District Attorney to take a leadership role in re-examining the exam protocols for victims of all of sexual assault, domestic violence, or abuse. And upon, and what I'd like to ask is for a 90-day examination of that, and then a report back to Children's Family Seniors Committee, and request that that report back be shared also with the City of San Jose. At that time, if there is agreement between our parties, I'd be interested in a timeline for training as well for all of our law enforcement. Supervisor Ellenberg, thoughts on just Section A?
Thank you, Supervisor Chavez. And a very quick thank you to everyone who participated and prepared for today's conversation. There's been, I think, a lot of really useful information shared. The report back from the district attorney is absolutely fine. James had a pretty straight face during that Christmas list of wishes for positions. And I am so grateful that our county is not in a place anymore where we are cutting positions, but being able to talk seriously about rebuilding. So I certainly support consideration of the additional requested positions with more information to come, and obviously in the context of our whole budget, but these are clearly critical roles to support.
Thank you, Supervisor. For section B, this is to receive a report from the City of San Jose's report, which again, I just want to say I thought was fabulous and robust. As part of the outcome of this, I'd like to recommend that the city and county, really through the Children's Seniors Family Committee and through the Public Safety and Justice Committee, that we schedule our follow-up every year in April so that we can check on the big bodies of work and not let it slip off our plate. There may be needs for more frequent smaller meetings, but certainly checking in and publicly checking in would make a lot of sense for all of us.
I would like to encourage, rather than limiting to CFSC, I think it's wonderful that that virtually the whole San Jose City Council has joined us through the legal instrument of committee of the whole. And while I think between the two of us as chair of Public Safety and Justice and chair of Children, Family and Seniors, we are carrying a lot of these issues, but housing is clearly a significant piece of this work. And I imagine that our colleagues would like to weigh in as well. So I would propose that the annual check-ins are for our full board as well as the full council.
I think Supervisor Ellenberg, what I'd like to do is assure that we're going to meet, because we can do that, and then make a request to the chair of the board, because I think that is a board chair choice. So we can formally make that request to our board chair.
Let's do that.
All right.
I jump in on that, Supervisor?
Sure.
So, and I think, because I would agree, Supervisor Ellenberg, but I also know if we were to present that to our full council and our mayor, that there was an interest to have this joint meeting, that the laundry list would grow extremely long and what else we would want to discuss, which is where I think it does, I get what you're saying though, right? Obviously there's a benefit to having everybody at the table, but I think there's also a lot more challenges that presents. And then what this does is it's kind of allowed us to focus on a couple topics at hand.
I think that's an excellent point. And I agree, we don't need to do additional 9-hour meetings, and I'm happy to keep the topics limited, but it then may beg the question of whether we need to be doing this more than once a year around different specific topics. So I'm happy to take this to our current board chair and see what he thinks or what his interest would be, and then come back to all of you somehow and see whether we want to do this targeted on a number of topics throughout the year.
And I actually second that. I definitely agree with that. I was having that discussion with Councilmember Arenas that this could be a good model for other specific topics where there's really close crossover and we're not necessarily meeting collaboratively or as regularly. So yeah, I agree.
Yeah, it's a great idea. I think we'll iterate and find the right combination. Thank you.
For item C, I want to request support from our procurement department to assist the City of San Jose in refining the research work, but also to recommend that the research, Councilmember Arenas, that you kicked off, maybe also something we want to have the working group that's looking at housing take a look at and see how they'd like to use the research based on the information they already have. So if we could ask the committee to take a look at that along with procurement. And what I'd like to add is that I would be very interested in getting the impacted population numbers, a timeline for how to address the primary strategies that come out of the working group along with the sources of funding. And what I would say to our team is that normally I would say, hey, take the time you need to look at it. But I think the state of California and the federal government are going to be offering resources for housing, and I want to make sure we're poised to get them. So what I'd like to ask is if the committee could have just a few meetings and then report back to both of our committees, so we don't have to try to get everybody together again, but to report back to both of our committees about the options for housing, because with both housing and childcare, I think we have a small window of opportunity that I don't know if we're going to get back, and I'd really like to take advantage of it. So I'll ask that both groups report back at the earliest opportunity, which may be in the August timeframe. But I want us to keep our eye on what the state and federal government are looking at. Supervisor Ellenberg?
I think that makes sense as well. Another place, and it may not fall squarely within this committee, but when we're looking at housing priorities and expanding a focus on survivors of intimate partner violence, domestic violence, it highlights for me again that our current VI-SPDAT process has a number of flaws in it. And while for the most part, we are talking here about women who are not or were not unhoused before the incidents occurred, are in danger of becoming entirely unhoused right now. And I also know that we've got challenges with unhoused women who are pregnant, who are not getting prioritized through the VI-SPDAT, and ongoing, we've had a number of racial equity issues. So I think it's a parallel ask, not as part of this committee's group, but looking at the VI-SPDAT globally in terms of what adaptations we may need to make and how we include survivors of domestic violence and intimate partner violence in that priority list, I think is an important piece.
And Supervisor Ellenberg, are you comfortable with it starting as part of this group and then getting a referral out of this group as to how the board should take a look at it?
If that doesn't slow down the work of this group, because I agree with the urgency around the state and federal funding windows, if it doesn't slow it down, yes. And if it's at risk of doing that, then I'm happy to look at a parallel process.
Thank you. And I know that Consuelo had to leave for another meeting. So what I'll do is, why don't we leave it as part of the motion, get feedback from Consuelo, and if we need to bring another referral to the board, we can do that.
Great.
And that would be my motion.
I'm happy to second it.
Great. And I wrote everything down for the staff. So
they'll be very appreciative.
Don't worry, we've got it written down. So I'll turn it back to Councilmember Perales.
All right, thank you. And I'll make a kind of a joint recommendation that I'll call on my colleagues here, or a suggestion for a motion, I should say. I don't have any suggestions in regards to the first report, but in regards to items 2 and 3, I do want to say, I want to echo what Supervisor Chavez has mentioned in regards to returning on an annual basis. So I'd like to make that as part of our recommendation. And then additionally, and it was kind of glossed over in the slide, but one of the slides presented the staffing that we have within our units here, and like the new special victims unit, and Angeli had gone over those slides. And we know that we are not near where we need to be with staffing, and that's not just in these units, that's across the board within the police department. But having, I think, a real better understanding of where we should be with adequate staffing in all 3 units, I think would be an important ask that we'll be making that we should make to the chief, that way he can lay out what his plan would be as we increase staffing. How are we going to then allocate some of that staff to these special units? And then in regards to the third item, I would agree as well with Supervisor Chavez that we should have an update. And what was the time frame you had stated, Supervisor? We'll copy that.
In August.
In August. So we'll make the same. I would suggest we make the same recommendation within our motion on that item. And now I'll pass it over to my colleagues, and I see Councilmember Arenas with her hand up. And you're on mute. We got you.
Ah. So it sounds like you made a motion, so I'd love to have a friendly amendment and hope you can consider my recommendations as part of your motion. And the first one is on 2A under city county collaborative recommendations. I'd like to direct the city manager to work with the county to form a working group with community advocates. And I'll leave that general so we can decide what those community advocates are. But I'm suggesting maybe the DA's office, Children's Advocacy Center, Crime Lab. But I'll let that for the experts to decide who should be at the table to identify the best approaches and regional responses to approve pediatric SART exams for children. And then to direct that city manager to bring to the next bi-monthly public safety report to PSFSS with all the barriers identified that prevent all child survivors from being referred to the Children's Advocacy Center if we find some for a SART exam, and maybe bring some recommended options for that. I'd also like to make a separate recommendation, and this is more to do with our housing study. And this is to direct city manager to partner with the county. And this sounds like we're on the same track, Supervisor Chavez, about partnering up and maybe creating a greater scope for this RFP. I don't know if we need to stick to just academic institutions or maybe non-academic institutions to also contribute. We have a lot of wealth of information around us today, so it doesn't have to be academic as part of my suggestion here. But the recommendation would be direct the city manager to partner with the County of Santa Clara to expand the existing City of San Jose data-informed substandard housing study RFP scope and needs to a joint study that is more robust and attractive to academic and non-academic institutions to gather research and data to better inform the trend of sexual assaults and best practices. And I'd also like to, this is a long one, but I'll send this to our city clerk so that she doesn't have to fret with it. Direct the city manager to review and explore the recommendations from the housing opportunities presentation for potential addition and prioritization to the city's sexual assault response and strategy work plan in coordination with the County of Santa Clara to report back to PSFSS. So it really is for us to work with the county, add this as part of our work plan. Now, these are separate from the county. These are just our city solos, and this is direct city manager to report the number of SART exams approved and referrals during our bi-monthly status reports from the San Jose Police Department and the costs related to those exams. Direct the city manager to follow the leadership of the county and Santa Clara to expand the sexual assault response and strategy work plan to the gender-based violence response and strategy work plan to include intersectionality of sexual assault, domestic violence, intimate partner violence, and human trafficking. And lastly, direct the city manager to prepare a manager's budget addendum for fiscal year 2021 to 2022 budget process to identify funding to expand the San Jose Police Department crime and intelligence data analytics capacity by 2 additional FTE positions and have 1 dedicated crime and intelligence data analyst to gender-based violence. And then, of course, you already mentioned, Chair, to also include some of the suggestions or missing positions that were reflected in the presentation from our police department. And then lastly, it's to direct the city manager to expand this existing trauma-informed care training to reflect patterns and trends of trauma to children under 12 and to learn more about stress indicators so that our police department, as well as our stakeholders and ourselves, can help facilitate next steps and referrals for first responders. And I know that we already have a commitment from our police department to work on this, but I think because we have all of these stakeholders and partners around us, that more the more is better in terms of resources. And so I think if there's some folks who can help lead us into some of the best practices for trauma-informed care training that involves children, that would be wonderful. And I know, I don't know if our DFCS director is still on with us, as a lot of people probably had to go to other meetings, but it would be interesting to find out from those folks who work with children and who have those best practices already established to help contribute to trauma-informed care training for our police department. And that is my motion.
And you did incorporate what I was asking Amelia's suggestions, so I will second your motion. Any of our other colleagues on the committee with suggestions or questions for the motion? Okay, not seeing any hands. Supervisor Chavez, did you want to take your vote and then we could take ours, or?
Sure. And the only thing that I would add, so first of all, that's very comprehensive, very helpful. And what I would like to add is, as it relates to looking at the exams, the team that's at the Child Advocacy Center, if we could use them as the locus of that discussion, would be helpful, just because I don't want to give them two different directions, Councilmember Arenas. So if we could use that as the locus, that would be helpful for, I think, for us, and also it's a good starting point. With that, so I have made a motion, Supervisor Ellenberg has seconded it, and I'll ask for a roll call vote.
Vice Chairperson Ellenberg.
Yes.
And Chairperson Chavez.
Yes.
Thank you.
Thanks a bunch.
Thank you. And I'll ask our clerk to do a roll call vote with our committee.
Arenas?
Yes.
Jones?
Yes.
Mahan?
Aye.
Jimenez?
Aye.
Peralez?
Yes.
Thank you.
All right, our motion passes unanimously as well.
Well, thank you. And I want to thank everyone. I know this was a long meeting and we had fewer issues this time. Last time I tried to put too much in and everybody was exhausted, and that ended us in 2 hearings. So I will just say to all of you, we really, really appreciate your work. And I so appreciate seeing the leaders of both of our organizations present today. It means the world to me, and I know it does to my colleagues, but thank you. And thank you to the City Council and Councilmember Peralez and Arenas and all of you who joined us today. We, and to the city manager and all of our police agencies as well, and all of our incredible advocates and the folks who came and sat through the meeting and listened and gave feedback. So to all of you, thank you. Have a real safe rest of your day. Please make sure you wear your masks, don't touch your face. And if you haven't been vaccinated, get vaccinated. And if you have, bring a friend. All right. Thanks all. Be well.
Thank you so much. Thank you. Bye-bye.
Thank you. The meeting has officially adjourned.